Three, two, one. We are live.
Good evening, everybody. I think this Trichy OG Society is very proud in taking up this webinar because it was a dream come true webinar. So I'm so excited to host it because this is a public connect for adolescents, and Deepa has taken so much of trouble to organize this, calling us celebrity, calling our president and everything. I welcome Dr. Alpesh Gandhi, sir, for this webinar, who has spared his time and is going to share his knowledge on the youth programs which are going to be conducted now. Welcome you, Dr. Alpesh, sir. And I welcome all the vice presidents, Dr. Ramani Devi, Dr. Ragini Agarwal, vice president from the South and West. And I also welcome Chairperson, Adolescent Committee, Dr. Girish Mane. All of you, I think I can I have their CVs on the slides? Can you share their CVs and then we go for a prayer? Can we have the CV of Dr. Alpesh Gandhi, sir? Sir, are you here, sir? Sir is with us, Deepa?
Yes.
Sir, yes, sir, yes, sir. So this is Dr. Alpesh Gandhi. I'm really proud to have him here in our society amidst his busy schedule. He's a president Foxy 2020, vice president Foxy 2013, governing council member of ICOG Foxy 2016-2017, chairperson Practical Obstetric Committee Foxy 2009 to 2011. He was a secretary, Gestosis India chapter, past president, Ahmedabad Obstetric Gynec Society 2007 to 2008, past secretary, Ahmedabad Obs and Gyn Society 2003-2004, and he's got lots of awards and paper publications on him. He's a practicing gynecologist since 25 years. His expertise in high-risk pregnancy and critical care in obstetrics and hospital management expert. Sir, can we have a prayer song and go in for small blessings from you? Can you flash the video?
Kurutvam kalyanam arogyam dhanasampadah shubham kurutvam kalyanam arogyam dhanasampadah shatrubuddhi vinashaya deepajyotirnamostute deepajyotirnamostute shubham kurutvam kalyanam arogyam dhanasampadah shubham kurutvam kalyanam arogyam dhanasampadah.
Yeah. Sir, Dr. Alpesh Gandhi, sir, can we have a few words of blessings from your side for this webinar?
Thank you, Dr. Ravi.
Thank you, sir.
Dr. Ramani Devi, my Vice President, Dr. Ragini Agrawal, Vice President Foxy, Dr. Girish, Dr. MC Patel, Dr. Rosa, Dr. Vidya, Dr. Deepa, all the esteemed faculties, dear viewers, a very good evening to all of you. At the outset, I would like to thank Trichy Society for inviting me and giving this honor. I would, since Lucknow conference, since my installation in January, I was waiting to visit Trichy Society, but somehow Corona has taken all these schedules, and we are meeting on digital platform. First of all, I would like to congratulate Trichy Society for continuing great academics in this difficult time of COVID-19. You all are doing great work by continuing essential health services like maternity services, time-sensitive services of sexual and reproduction. So Foxy is proud on its all 260 societies. Trichy society is very active and vibrant society. I have been told that this webinar is also viewed by the uh, public, adolescent girls, boys, youth. So I would like to first introduce Foxy to all of them. Foxy is the Federation of Obstetrics and Gynecological Societies of India. We have 260 societies across India like Trichy Society. Foxy is the largest organization of any medical specialty, not in India but across the world, with its nearly 40,000 gynecologists as its members, practicing across India from north to south and east to west. And we are taking care of nearly 50% of population, we can say, from adolescent girls, teenage period, then reproductive age, then menopausal age, and geriatric problems, geriatric age. And it is also one of the oldest organization because Foxy established in 1950 January, before our first Republic Day. So Foxy is working since 70 years and taking care of 50% of the population. The main aim, mission of Foxy is to reduce maternal mortality rate, neonatal mortality rate, and morbidity, and to advocate and promote and do research in sexual and reproductive health, and to advocate the rights. India is the youngest country, we can say, in the world. If we look at the population wise, then the 21% of the Indian population is adolescent. We have nearly 243 million adolescent and youth in our country. And therefore, it is very, very essential to take care of them, to train them, to educate them, to sensitize them. We believe that we need to train them, inform them, make them aware about preventive aspects, preventive adolescent health care, legal protection, which this age group population is legal protection provided by the different laws and acts by Government of India, different safety measures. We also need to learn them, teach them how to say no, how to keep themselves away from the drugs addiction, alcohol abuse, drug abuse, different tobacco and different habits. They also need to learn lifestyle modifications and role of many other things like exercise in their lives. Foxy has just celebrated World Youth Day on 12th of the August recently on preventable adolescent health education, and I am happy to share with all of you that nearly 1,21,000 adolescent and youth have attended this program. Probably this may be the biggest, and we are going to have in the book of record for this. And I am more happy to inform you that we have received 10,000 questions. So we know that there are lots of questions in their minds, but there is no platform, or they do not know where to reach, to whom to ask, from where to get the guidance or to solve their queries. So Foxy is one platform, and 260 societies like Trichy Society are the platform for them. They can contact any of us, any of our society. They are always ready to help you and to solve your queries. We are going to come out with a book on frequently asked questions by adolescent on this preventable adolescent healthcare aspects and other aspects. We are thankful to all the schools, colleges, universities, NGOs, all those who are supporting us in this motive. And there are so many preventable and so many other aspects, like we need to uh, inform them about what is anemia, obesity, the effects of obesity, PCOS, sexually transmittable diseases like HIV and AIDS, personal hygiene, menstrual hygiene, nutrition, what is the role of nutrition, psychological problems, internet abuse, substance abuse, and so many aspects are there. So I think whatever possible in this webinar, everything is not possible to be covered, but our experts will try to discuss whatever is possible. Our main intention is we believe that since adolescence and teenage is the most important age in shaping ideas and attitudes that will form the base of a healthy and happy girl and women. Adolescent health education, especially preventable education, can go a long way in keeping the nation strong and healthy and clean. So, through such webinars, our aim is to see that the youth of our country learn to prevent themselves from preventable diseases, realize the importance of freedom, and not to waste one's freedom in doing the wrong things that will hamper their lives. So with this brief introduction about the aim of discussing these topics and organizing such webinars, once again, I wish a grand success to Dr. Ravi, Dr. Deepa for grand success to this webinar, and I also wish happy learning to all the viewers. The Trichy Society have selected a galaxy of faculties, very experts from different fields, and I wish please take benefit of their expertise, their knowledge. They are with you today, and this program, I think many doctors are also attending this program. I'm sure we all are going to be benefited from this scientific deliberation. With this, once again, I thank Dr. Vidya, Dr. Deepa for inviting me, for honoring me. Thank you very much. I wish all of you a safety and happy learning. Thank you.
Thank you so much, sir, for your very good messages to the adolescents. Actually, as you say, they don't know whom to seek and where to get the news from what they want. So it's a very good webinar eye-opener where they can freely ask questions here. It's a public connect webinar. And also the FAQ book, which you said Foxy is going to release, is going to be a very good information for the adolescent public. So I think as soon as it is released, we get to know about it and we can publicize it also, sir. Thank you so much for your kind words. May I now ask our Vice President, Dr. Ramani Devi, Vice President Foxy South, to speak a few words of
Thank you, Vidya,
blessings for this webinar.
To me.
We are really proud.
I offer my virtual floral bouquet to our dear President, Dr. Alpesh Gandhi. Kindly do receive it.
Madam, before I could say, you said.
Okay. Okay. So it is really very nice to have thought about this particular problem because India has got the maximum percentage of adolescents. And by 2030, I think 40% of our Indian population is going to be an adolescent. So it is our duty on behalf of the doctors to take care of their health, not only physical, but mental health. And so many other things we have to look into it. And to quote Swami Vivekananda's quote, see, what he said was, give me 100 youngsters, I will make a beautiful India. See, to say it in Tamil, he said, 100 இளைஞர்களை என்னிடம் தாருங்கள், பாரத தேசத்தை மாட்டிக் காட்டுகின்றேன் என்று வீரத்துறவி விவேகானந்தர் கூறினார். Same thing, Dr. Abdul Kalam also said, India is going to be filled with adolescent in 2030. We will be having the maximum population of adolescent in the among the whole world. So it is our duty as a doctor, as a teacher, or as a parent. We have to shape up the future adults of India. So I congratulate Dr. Deepa and Vidya for having brought this excellent idea of sharing this not only with the doctors but also with the public. And today we have a galaxy of speakers who are very, very special in their own field. And I think they are going to give so much of input that it is going to be a real useful program for the adolescent community of our India as well as the doctors. So thank you for this excellent opportunity given, and wish you all the best, Trichy Society.
Thank you so much, madam, for these very good messages which you've given us. Please stay till the end to share your knowledge with us, madam.
Sure.
And thank you for sharing the e-bouquet on behalf of Trichy Society. Thank you so much, madam. Now, may I request Dr. Ragini Agarwal to say a few words of blessings for this webinar.
Thank you, Dr. Vidya.
Yeah.
First of all, I will congratulate you, Deepa and Trichy Society, for coming up with this adolescent program and connected with the society. The whole month by our President Foxy has announced as a adolescent month in the Foxy, and we are doing many programs on adolescent, as sir has already told about the e-conclave. And at the end, we are coming with the 3 days e-conference on the various issues of the adolescent too. By shaping the adolescent health, we can shape the generations. And it is a very important thing that you people are doing, that educating the society how to prevent and promote the good health of the adolescents, not only physical, mental, social, and spiritual. And with this word, I'm not standing between you and the delegates. They will have a good academic feast with those learned speakers which you have called today. Thank you very much again for calling me and making me a part of this great webinar. Wishing you all the best. Bye-bye. Bye-bye, viewers. Have a happy learning. Thank you so much.
Thank you so much. Be with us till the end, madam, to share knowledge. Yeah. Thank you so much. Can we have the chairperson, Adolescent Committee, Dr. Girish Mani, to share a few words with us?
Yeah, good evening, ladies and gentlemen. Good evening, boys and girls. Good evening, mama and papas. Good evening, all the doctors, all the faculties. Good evening, dear Alpesh sir, Ragini madam, Deepa madam, Vidya madam, everybody. At the outset, I would like to share my sincere thanks to Dr. Vidya madam, to Dr. Deepa madam for inviting me for this program, and special thanks to Dr. MC Patel. Friends, this word adolescence, it is derived from a Latin word adolescere. Adolescere means to grow, to mature. I think in your language it is called as thulir, if am I right? Okay. There is a lot of physical, there are so many physical changes, there are so many mental changes, as well as there is a growth spurts. And because of these physical changes, the adolescent, they faces some physical disorders. Then because of some mental changes, they may face some mental disorders, for example, depression, suicidal tendencies, and so many things which we are going to see in the coming lectures. And because there is a growth spurt, there is an increased nutritional need, and that's why some diseases, they are common in the adolescent. For example, anemia. And in the girls, especially because of the start of menstruation, these girls, they are in need of iron more than the boys, and that's why anemia is common in the adolescent. So there are many issues which are really needed to be discussed, and this discussion is not only important for amongst the doctors and the parents, but even the adolescents, they should be aware of the facts. And if the person himself or herself is aware of the facts, then it is always easier to take care, and they will really get the messages which are passed to them by the parents or by the teachers or by the doctors or by any other person. And that's why this kind of programs, they are very important for saving the future of the India, which is there. And as Alpesh sir has already told, that almost 25% of the Indian population is covered by the adolescents. It is almost 243 million. So it's a huge population, and that's why we are said to be the youngest country of India. So I wish my best luck to every faculty, and I also extend my wishes to all the viewers and enjoy the coming program. Thank you.
Thank you so much, sir. You're apt to be the chairperson of Adolescent Committee, talking and giving such sharp messages to the adolescents. And I really thank you for blessing us a good success in this webinar. And over to Dr. Deepa to moderate the session. I think you can take over and introduce our speakers, and we go on to the scientific session directly.
Yeah. Thank you, Vidya. First of all, my respects to President Foxy, Vice Presidents who are here, Chairperson, and all the great faculty who are here. Not only the faculty, to all the people who have logged in. They can be doctors, their parents, there are children, there are boys, girls, and across all age groups. First of all, thank you to Vidya for encouraging me to have a dream project like this. Which has been I've been harboring for quite some time. So I think it's materializing today with great expectations. Why are we having this webinar at all? I'll just to think about it. If you see, India is home to 33% of child brides on Earth, and between 15 to 19 years, which is very appalling, which is a very big number. And at least 1.6 crore girls become pregnant each year, and half of those are unintended pregnancies. So, and the second thing is today's children are growing up in a very different atmosphere. We grow up with families and books. But today the children are growing up with mobiles and computers and the media more than the family and the parents, and probably the peer group matter to them more than even we do. Or perhaps things have changed so much that the parents are so busy, they don't have time to spend with the children. They're all working, and so probably the peer pressure is more on these kids. And so whatever we are going to talk today is all real life issues that we are going to discuss. And believe me, nothing is an exaggeration. Everything you're going to see as case scenarios. So if you have some friends who need to log in, if you think it's going to be a very, very interesting session, if your friends haven't logged in, if you think you can call up and bring in more people. And it's my great pleasure to welcome all the faculty for today. Let's get going with the session. Our first speaker for today will be Dr. Rosa Oliai. Can I have the slide, madam's? Yeah. Madam has done great work in the field of adolescent health. She was a vice president. She's the vice president, Family Planning Association of India. She was a member, South Asian Regional Governing Council for International Parenthood. She was a fellow and member of board of Governing Council, ICOG. She was a vice president of FOXI 2014. She's a WHO consultant, expert panel meet on ARSH global guidelines, WHO Geneva. She's a director of Oliai Hospital at Lashkar, Gwalior. Next slide, please. Not only these, Madam is, can I have the next slide? Madam is also an internationally renowned person in this field. She has won several national awards and prizes. She was awarded the prestigious DC Datta Prize. She was awarded the prestigious Mero Hansotia Prize. She was nominated by the FIGO as faculty speaker during the WHO session at the XX FIGO World Congress at Rome in 2012 during the special session on preconceptional care. And she's been appointed as WHO consultant representing FIGO at the expert panel meet for making global guidelines on adolescent sexual reproductive health at Geneva. So no wonder you will be the best person to talk to this kind of an audience, Madam. Please welcome Dr. Rosa Oliai. Can we have Madam on screen?
Thank you, Deepa. Can I start sharing my screen?
Yes, ma'am. Please.
Yeah, because we've been talking, and I think the youths are more interested in now saying what we are going to share with them.
Absolutely.
Yeah, so let's just go about, and the question that's usually asked during web is, am I audible? Here I would say, is my screen seen?
Yes, madam. Please
All
proceed.
right. So friends, I hope you all can have your cup of coffee and tea with you all. It's 6 o'clock sharp and we are really deep on time. So it's really a wonderful privilege to be sharing with you what is really important. And over the time, we have seen that preventive measures is so very important. Here, I would like to share with you what Bill Gates says, because I think most of the adolescents and youth would relate to him. Treatment without prevention is simply unsustainable. So I think it is something very apt for the time that we are in during the corona pandemic, COVID-19, which was never heard before. And we need to be preventing ourselves from getting infection. Same time, trying to see what are 22% of the population, which is you adolescent, is going through. So you see, for the parents who are here, for the teachers of the schools and colleges, it's a change of hormone, it's a change of environment. And more so as we are coming today in the society, we see that things are really changing. 20 years back, or maybe during my time and Deepa, your time, things were not like this. We never had communicable diseases, which is now on the rise. However, there is always a prevention, always a cure for a lot of issues. Now, when you think about reproductive health, it talks about everything, right from pubertal ages, when you're just growing up around 11, 12, to psychosocial issues, nutritional issues, injuries, chronic conditions, mental health, which will be, of course, covered in large extent with the too extensive 3 more speakers. I'll be talking more about the sexual reproductive health. However, what is really is on the rise is unintended accidental injuries, depression, drug abuse, which will be, of course, dealt with. Now, when we see a sexually healthy adolescent, when everything is going on fine, these are the group that really appreciate their own bodies. They don't have any health issues. They have regular checkups. They don't have multiple relationships. They identify their own values around, they're very positive towards life. They communicate well with families and friends, which is a very good point in them. They know how to say no and negotiate with sexual limits. And they really refuse things which are not good, like drug abuse and other things. And they don't indulge in dangerous stuff like sexual contacts, and they know where to go for information. However, when we see that there is certain risk behavior in few of the majority, let's say, of the adolescents and the youth, and that is because this is a hormonal stage of life and they have an intensive feeling toward, they react to things very quickly. They need to have immediate gratification. They have lack of awareness. As said previously, they don't even know where to go, whom to go to. They need someone to listen to. They don't want every time that someone should tell them what to do and what not to do. And they're not aware of the consequences of the diseases, of the problems they're facing. Also, the family has got a lot of issues on them, like loss of family. There's a lot of pressure from parents for getting good marks, getting into a good profession, getting into job. Poverty is something else, which is also on top of everything the present situation of COVID has given us everywhere. Peer rejection, peer pressure, these are the things that really make them go for risk behaving behaviors. Lower self-esteem, uneducation, not showing interest in education, and all this leads to unprotected sexual relationship in adolescence because they're prone to it as a hormonal statuses. And these actually leads to a lot of issues like unwanted pregnancies, leading to abortions. Abortion could be unsafe abortion done with places which is really dangerous. Later on, pregnancy continues, premature parenting. Later on, all these leading to infertility. The girl will not be able to conceive. And finally, death. Sexual transmitted diseases forms a bulk of these issues. And to make things a little more easy for you to understand, these are infections which are transmitted sexually by a contact person. And these sexual transmitted disease, when we say, is a broader era, spectrum of the reproductive tract infections, which means any infection in the abdomen towards the pelvis, which could also not be related to sexual transmission, sexual contact. It could be related to gastrointestinal, your area where sometimes you all are constipated, or maybe because of urinary tract infections. So all these conclude together. However, today the topic is related to sexually transmitted diseases. In this chart, if all of you are able to see, is there are some certain sexually transmitted diseases which could also be transmitted without sexual contact. That means through blood transfusion. Like we have HIV, AIDS, serum hepatitis B. There are certain infections could be caused due to anything like iatrogenic. That means it could be related in something else that has done to you, like unsafe abortion, during a medical termination of pregnancy. So infection could go to you that way. Or it could be certain bacteria or fungal infections which could be, causing this. Why we talk about this is because we have 19 million of these young youth getting affected. Half of the people between the age group of 15 to 24 years have got some sort of sexually transmitted diseases. And let me tell you all, not many have symptoms. So you may not be really thinking that you have the infection, however, but it's in you. Diseases like HIV, AIDS, human immunodeficiency virus, human papillomavirus, which is called HPV. I'll talk about it a little more, but this is something which is now known and on the rise. Chlamydial infection, gonorrhea, genital herpes, syphilis, chancroid, so on and so forth, to pubic lice, scabies, trichomoniasis. Most of them, as you see, will be symptomatic. However, some of them, like chlamydia, gonorrhea, HPV, hepatitis B, or genital herpes, may not be having any symptoms. And these could also be transmitted through sexual contact. That means your partners may be having these, but they may not be knowing about it and giving this. The magnitude of problem is really on the rise because WHO has given 340 million of new cases every time. And seen in India, many of the cases which are coming to us in the clinics are women. 15 to 24-year-old represent 25% of the sexually active population in the country. That's why, friends, we've taken this subject for you all. 1 in 20 youth contract these diseases, and 55 to 70% of the women have at least one symptom. And these clinical symptoms, when they come to a doctor, would be in form of the discharge, itching, repeatedly going for urination, and pain in the abdomen, which terminologies are written like cervicitis, vaginitis, and PID. However, when they come to the doctor, we try to see and examine the patient and find out majority of these infections, which are sexually transmitted. Most of the women suffer from bacterial infections, fungal infections, trichomonias, chlamydia, and gonorrhea. This has been based on the laboratory findings. Now, the good news, I'll give you good news and a little bad news. So the good news is that these infections, which I just named them to you, some of them you must not have heard, they are preventable and they are treatable. So that's a good part. However, we have seen in a lot of studies that when we treat a woman, we also like to treat the male partner. But it has been seen that not many of the male partners take the treatment, which is really not good because that infection keeps on cycling between them. The bad news, a little, you should know all about it, is that if not treated on time, these could lead to infertility. That means once the girl gets married, she will have problems of conceiving and getting a child because the tubes get infected, blocked. The girl could land up into an ectopic pregnancy, meaning that when she gets pregnant, because of the infection, the tubes are a little damaged. So the baby is outside the uterus, which is not a good thing. It's a very dangerous thing. Emergency operations have to be done. They land up to a cervical cancer and pelvic inflammatory disease, which is a really very painful phenomena. And it stays for a very long time in a girl. Now, you ask me that what are the risk factors? How to avoid, of course, we'll tell you what are the risk factors? What will lead to these complications later on, like cervical cancer, which is preventable? Early age of sexual exposure, early marriage and childbirth, abortions, repeatedly terminating a pregnancy. I'll talk about this in great depth later on. Increased number of sex partners, poor personal hygiene, excessive blood loss during menses. So those girls having excess of bleeding, you have to be a little careful because your immunity comes down, your hemoglobin goes down. High risk behaviors of drug abuse, smoking, eating less, crash dieting, sleeping till late, getting up late in the mornings, all these are high risk. How do you prevent this? It's very easy, as I said. The whole talk today, the whole seminar today is about how do you prevent this? I would like to request all those girls younger than 25 years, you must get yourself examined and screened because you prevent this earlier, you will not have any complications later on in life. Your sexual partners should also be screened and they also should be taking the treatment because now you know that in men, it's really, they're asymptomatic. They do not show whether they have gonorrhea or chlamydia, trichomandis. But these infections, if given by the male partner to the woman, it shows more aggressively in the woman. And all those going under a test for a sexually transmitted disease, they should also be screened for HIV, hepatitis B, and syphilis. And I think this should be something when your doctor tells you, you must not shy away. You must be, because this is what you have to take care of yourself. There's nothing beyond it. Some of the answers to prevent the consequences, in short, in this diagram will depict that you have to have A, B, C policy in your life system. So when you say promote abstinence is socially acceptable in Indian values, which is really speaking most effective. Protect yourself from sexually transmitted diseases and have abstinence. No sexual contact. Otherwise, follow the B, that is faithful. If you're into a relationship, be into a monogamous relationship, not having many sexual partners. And of course, a broad spectrum of contraceptive, which could be, prevent this totally, because you're not only going to use the contraception for protection of pregnancy, but you're going to protect yourself from transmission of these sexually transmitted diseases. So friends, in short, currently no means exists right now in this present world that can prevent you from anything except abstinence. Or otherwise, mutual monogamy could be one thing which could prevent you from sexually transmitted diseases. I did mention about contraception because I think at this stage it's very important for you all to know, in short, what is a basket of choice for you all. For the girls, we have the hormonal contraception, which comes into a 21-day packet, freely available in the market. It has to be taken during the same time at night, not to be missed. We have also another contraception by the name of emergency contraception. I'll talk about this a little later on in depth. We have injectable contraceptions for the women, intrauterine contraceptive devices, which is known as COPD for the women. We have the barrier method, which is for men, it is condom. For females, we have a female condom. And of course, we have a permanent sterilization for male and female, which of course, once you're married, you have a couple of children, you can do that, not now for you. So if you see this table, if it's really light for me to say, I don't know how you're viewing it, this is what happens very on a Zoom, and the audience are not interacting with you. However, when you see from as we go up the chart, the efficacy of this contraception becomes better. So if you see down, if it is going to be not using any contraception, every 100 women not using any contraception, 30 would get pregnant. As you go up using barrier methods like male condom, diaphragm, female condom, oral contraceptive pills, efficacy increases. As I told you, there's something, a new kid on the block like emergency contraception, which is very important. There are a lot of myths about this. It is useful only and only when it is sexual contact which is inconsistent. Randomly you meet, you have a sexual contact with your partner. It's incorrect contraception use. You cannot, you've missed your pills, you are not using it properly, and that's the time you can use this. So it's an emergency, as the name says. If you've had an unplanned sexual intercourse and you don't want to have a child, this can only be used as a backup method, that you have nothing and you have this with you. There are 2 tablets, 2 different forms, 0.75, 1.5 milligram tablet is really readily available over the counter, but it should not be taken like chocolates very often. They've got their own side effect. But let me tell you, it does not protect you from the sexually transmitted diseases. And it does not affect your pregnancy once you're pregnant. It just avoids making you becoming pregnant. So please, if you are pregnant, this cannot be used. What would be appropriate for a young person who doesn't want to get pregnant, you're married, not married, please use dual protection, because a dual protection, by that I mean a barrier method like a condom and an emergency contraception, or maybe a oral contraceptive pill which you're taking every day with a condom, because you don't want to be pregnant. You don't want to have the sexually transmitted diseases at the same time. So you're going to avoid getting infected. You're going to avoid getting pregnant. So the best method would be using these 2 together, because the failure rate of using, for example, the condom or the barrier methods, if you see, given a chance, it's much more failure than using a contraceptive pill. So for youths, it would be much better using them together, so the better the result would be. Now, what if the question often asked during these seminars, and the youths ask, so you said about prevention, but what happens if I made a mistake and I'm pregnant? Now, what are the options for me? In short, if you're married, keep the baby. No doing medical termination, unless it's something. But if you want to terminate it for reasons best known to yourself, we have medical termination pills which could be used. When you go to a doctor, your health professional will tell you below the 9th week of pregnancy, it could be used. That means the moment you feel you're pregnant, you must rush to your doctor. There are certain pills which can be helping you in removing the material products of conception without undergoing a surgical, operation. Unless and until it's really big, then you will have to undergo a surgical operation under anesthesia. And mind you, you have to be very careful where you go to perform these operations, because not all centers are safe. Not all centers are recognized by the government of India. Under such circumstances, if you go to a place which is not recognized, you'll end up in having unsafe abortion. What I mean to say by unsafe abortion is something which will ruin your life. It's an emergency situation. Quacks will be performing it for you. They'll be giving you a lot of infection inside your genitals, especially the women I'm talking about. There has been a study that in India, 2/3 of the 6.5 million abortions are illegal and unsafe. So you have to be very careful where you go for your abortions, because complications of sepsis, hemorrhage, cervical cancer, all these in the young children are because of repeated such acts of medical termination. But if you go early, you have the pills with you. Here, I would also like to talk about cervical cancer, because I feel that sexually transmitted diseases, I did mention to you about HPV. Mind you, HPV virus is transmitted whether you're using condom or not. So you have to be very careful, single partner, avoid multiple partners, try to get the cervical vaccine as early as you can, preferably before the act of sexual contact, because we have 100 varieties of HPV virus. Few of them cause cancer, and that's really not good. Beyond this, it's okay if you don't know, it's too scientific. But all that you should know is you need to get the cervical vaccine. This is for girls. In India right now, we don't have the vaccine for boys. So girls, be careful. You have to get this vaccine done for you. When we talk about health, especially during coronavirus, I think often the question is asked that what is health? What health is defined? And one of the beautiful speakers just before me mentioned about the 4 aspects of health. WHO has defined health so beautifully here. And I think all of us should think in our minds to see the state of health is complete physical, mental, social, and spiritual well-being, and not just absent of disease. Now, we've been talking till now about physical health, prevention, how to cure, where to go. Mental and social health will be discussed with the next few speakers. But I thought this is so very important, especially during the coronavirus time. Most of us are praying. Here I would like to quote again from Dr. Abdul Kalam, Learning from Missions, December 2007. He beautifully defined spirituality for us. He said, even though theology of religion is for each religion different, but the spiritual component spreads a value to be inculcated by human beings for promoting a good human life and welfare of the society while pursuing the material life. He talks about values: respect, patience, humility, punctuality, chastity, spirituality. It's an orientation which gives us the power to resist the negative influences in society. Today's youth are open to many temptations. The appropriate place for the expression of sexual impulse is marriage. The quote taken from the Baha'i Holy Writings. And I think most of us right now, with the pandemic from March onwards, we've realized how important it is for us to meditate. We are sitting in our own houses right now. We're not going out. We know that God here to us, Almighty, is with us. We cannot go to the mandir, masjid, mosque, anywhere, churches. We can sit at home, meditate. Yoga, one of the best ways for us to do this meditation. And this makes us confident in life. I've seen a lot of youths, a lot of young generations who are helping the elderly in societies. They go running around shopping for the old, for the aged women, men. They help them out. They feel so happy because work in the spirit of service is like worshiping God. So for all those youths who are there, you're working in your own houses, helping your parents, cleaning up, doing the shopping for them, especially for the elderly. It is such a bounty for us, for the youth today to do. With this, one gets empowered. So when health overall, everything is together. You can combat a lot of things. You can make situations, turning them very positive. Sometimes, as you see in this diagram, that everything doesn't really work out the way we want it to be. We really wanted, I know a lot of students wanted to leave, to go for higher studies abroad in the month of February. Once the lockdown has happened, a lot has happened. A lot of the examinations are not taking place. But then, friends, let's make use of the situation. Let's make it appropriate for the time and be positive. Make our weaknesses our strengths. Learn. Take advice from the proper personnel, your teachers, the doctors, the professionals. We are always there with you all. We have youth-friendly health centers all over the India. For those gynecologists who are listening to me, in 2012, we've come up with a document with WHO, Government of India and FOXI in establishing the youth-friendly health services centers. The document is on the FOXI website. That was the time I was a chairperson. And I'm sure that will help us to know that these youth-friendly centers are also now available for those young people listening to me. All over the country, the government of India has made the Rashtriya Kishori Swasth Karyakram, which deals with ASHA workers. So those of us in the rural areas, in the districts, you will be able to get help, contraception, even emergency contraception. The ASHA workers roam around and have the OC pills with them, 21 days pills with them, one emergency contraceptive pill, a condom, and these are given free of cost, just to prevent the future diseases, just to prevent you from falling sick. So do avail this in your districts, in your cities. These are the centers by the Government of India. I would like to ask Deepa later on to share these two slides, which I'm sharing with you, so that, see, we talk about health, we're telling you what to do, but where to go? None of the seminars usually talk about this. I'm so happy that Deepa asked me to share these with you. Other places where you can go, and I'm very closely working with the Family Planning Association of India. We have 40 centers all over India, and we are serving the rural section as well beside the city. These are the websites. Click this picture, go to the people there. There are trained professionals. They manage men and boys' health problems as well. So don't shy that it's going to be only for girls. No, Family Planning Association is for both boys, girls, men, women, elderly, everybody together. So it's going to be a basket of treatment for all of you. Now, I would like to turn to my friend, colleagues, gynecologists, and I'm sure the youths will be very happy to hear what I'm going to say. So, friends, my dear colleagues, what is the reason why these youths, these young people do not come to us in our clinics? It's because of the judgmental attitude of not only us, but even our staff. So we need to train our staff, we need to train our personnel, get the training of the adolescent-friendly health centers. What is more important is the confidentiality of the youth and adolescents. You see, they come to us not to give them lectures. You see, today we talked about health, physical, mental, social, spiritual. Today I can talk, it's a big forum. But when they come to my clinic, I need to be professional with them. I cannot be judgmental. I cannot scold this child and say, why have you done this? So friends, we have to be very careful in understanding that they've come to you for help as a professional. You need to help them out, give them the direction, what has to be done. We have to understand the magnitude of problem with these adults. They may not be having parents who are, they can help them with these issues. We are there to guide them. They have a social stigma. They don't want their friends, their, peer pressure is on them. They don't want anyone to know about the problem. They feel shy. That's why they come to you. Most of them would also not be able to afford any kind of procedures. So I think, friends, my gynecologists who are sitting here, and even parents should hear this. We need to talk more with our adolescents and our youths, and we need to have provided private and confidentiality in our clinics so that when they come to us, they know they've come to a professional person where they can get help. So we need to treat our adolescents and youth with respect, dignity, be non-judgmental, be friendly and offer suggestions to them, provide correct and complete information, suggest options for safer sex, contraception, involve them in decision-making for their own behavior. Let them decide, but guide them. Suggest that they spread the information among the peers. All those who are hearing to us today, I would like to request you all, I cannot see you beside my own computer screen. I can see only just few faculty, but all those who are hearing to us, make sure that whatever you learn today, even if you learn a small sentence, share it with your other friends because knowledge has to be spread out. And I think I would like to really thank the organizers for giving us this chance to spread the message of holistic approach. It cannot be just a single gynecologist who will be helping you. We have pediatricians, we have psychiatrists, psychologists, we have lawyers who could help us out. We need to understand the need of the adolescents, friends, and young people's involvement, community mobilization, supportive policies is so very important. For Girish, who's adolescents chairperson here, who's hearing me, you must inculcate this in Foxy. We have growing evidence, friends, that we can increase people's utilization of services by focusing on availability, accessibility, and accessibility. They should be able to know where it is available, when it is available, how they should go there, and where it is available. So at the end, that is the end of my talk, and I promise to be short. Thank you so much. I'll stop share my screen so that the organizers can go on.
Madam, very well said. I think you covered most of the aspects that we need to talk to these youngsters. As you said, risk-taking behavior is perhaps the most important thing here, and their first teacher is often Google and not you and me. So that's where the problem comes. So, and also the second teacher are their friends. So you've clearly explained how to deal with situations. In a situation where children want to be career oriented and want to marry late, and maybe contraception is a good choice instead of abstinence, even though we can say that prevention is the best. So, very well said, madam. I think it's time to move on to the next speaker. There is already a question. If we have just one or two questions, we can just take it at the end of the session. At what age children should be taught about sexuality, and by whom? Who is the right person?
Rosa, madam, of course.
Okay. So, parents, all those teachers were sitting there. I think sexuality should be taught at the age of 11, 10, 11. And these should be taught actually in a very proper way. The parents cannot teach this to their children. However, parents need to be appropriately, spoken with. Teachers are the best persons in school. And I know that, Foxy, we have been training teachers. We've been going to schools. Please, the principals who are hearing us, invite the gynecologists and invite the pediatricians to you. We need to have health education. We can have it separately for girls and boys in schools. Otherwise, for all those of you listening to me, schools are not providing you this. We have these adolescent friendly health centers, which is always there with you. Gynecologists are trained for that. And as I gave you the two slides, which has got the websites, please go there. You can visit the website, put your questions, answers can come. And I think these health issues can be done in a very appropriate way without feeling shy. We have to be, see, knowledge is always important. Gone are the days where, now look where we are. We've been able to capture universe with us. And we have such good gadgets like computers, everything. You can access everything, and people need to develop physically. So I think sex education is very important. Yes, it should be shared in a very appropriate way. And of course, as I said earlier, prevention is better than cure.
Thank you, madam. Thank you. It's time to move on to the next speaker.
Deepa, can I add
yes,
something
yes,
here?
Yes, sir. Please, Dr. Harish, our senior pediatrician, is here.
This is a very, very important question. Very often asked by parents, teachers, the adolescents themselves also. My take is a little different. I would say whenever child is curious about these issues, explain. Explain in age appropriate manner. Let it be 5 years, 6 years, 7 years, 8 years, whatever the age is. This is one. And second, to all girls, it should always be before she begins menstruating. Okay, whenever she develops first signs of puberty, she should be told about sex and sex education. This is a very, very important. And you, all the gynecologists, you must have experienced that even pregnancy can occur without having menarche. Okay, so this is a very, very important part of the thing. And I would suggest that all mothers, they should involve their daughters in their own menstrual period management. So this is a very good opportunity of telling them about this kind of a sex education. Sex education for boys is very, very difficult topic. Okay, so that is a very different thing. But I would say whenever they ask, educate them, tell them, and when they grow up, tell them what are the main sources of education. But it is the parents who should tell about these things. Thank you.
Thank you, sir. Deepa, shall we move on to the next speaker?
Yes.
Shall I invite Dr. MC Patel, sir, to give his talk on violence and legalities of POCSO and MTP Act? Can I have his CV on screen, please? Yeah, Dr. MC Patel is a consultant obstetrician gynecologist and medico-legal counselor. And he's a vice president FOXY 2018. He's an organizing secretary for AICOG 2017. He was a chairperson ethics and medico-legal committee FOXY 2011-2013. And he was a honorary joint secretary state organization of gynecology and obstetrician of Gujarat 2019-2020. And he was organizing chairpersons was that, sir? Con 2018, yeah. And he was a member of State Supervisory Board, PNDI Committee, Gujarat State, 2005 to 2009. And he was a member of National Managing Body, Indian Red Cross Society headquarters 2019-2022, and he was a president of Ahmedabad Obstetrician Society between 2010 and 11, and he was a national president, National Medcon organization 2016 to 2018. He was an organizing chairperson, Vivekanand NMO conference 2013. Over to you, Dr. MC Patel, sir.
Thank you, Dr. Vidya, for kind words. And please allow me to share my screen.
Yeah, you can share your screen, sir. Saurabh?
Is it seen?
Yeah, it's getting, yes, sir.
Seen.
Yes, sir, it's seen.
Okay. So, straightway to the subject, suicide in teenage group, when happily they are enjoying their life and ECG is going very smoothly, and they cut their ECG, making it straight for some reason, and many trouble start. One more problem of adolescent period, violence to the adolescent in adolescence. And one more two topics I am going to uh, discuss very briefly, that is protection of children from sexual offenses Act 2012 and Amendment Act 2019, Medical Termination of Pregnancy Act 1971 and Amendment Act 2003. So at the outset, I would like to thank Trichy OBGYN Society and Dr. Vidya, President, and Dr. Deepa, Secretary in particular, for inviting me to share my views about the subject. Due to paucity of time, I will be little quick and very brief in the topic given to me. So many a times questions come, is it worth discussing? Yes, then why? Because our teens are precious and naturally their lives too, they are also precious. And suicide is the second leading cause of death following motor vehicle accident among teenagers and young adults. And as far as violence part is concerned, we observe that adolescent girls reported experiencing high rate of physical and sexual violence from dating partners. This is very alarming situation. Approximately 1 in 5 adolescent girls, that comes to almost 18 to 20%, reported being physically and or sexually hurt by a dating partner. And 1 in 10 high school students has been purposefully hit, slapped, or physically hurt by a boyfriend or girlfriend. And 1 in 3 adolescent girls is a victim of interpersonal violence. And 52% of teens who experience digital abuse are also physically abused. And 43% of teens who experience abuse say some of it happened on school grounds. So this is also a very serious matter. So as far as dating violence in teen populations are concerned, some more statistics, the age range with the highest risk for most severe violence in relationship is 16 to 24. According to Center for Disease Control, about 1 in 5 school-age females has experienced physical or sexual abuse by dating partner. About 1 in 11 teens reports being a victim of physical abuse each year, and 1/3 of adolescents have at least one friend who is in a violent relationship. So, as far as vigilance part is concerned, on part of adolescent, him or herself, as well as on part of parents and guardians. So you should be watchful about friend circle of your child and children, their familial background of friends of your child or children, their activities, frequency of child going outside home other than for school, careful watch and vigilance, their involvement in rape and net, and many a time, this is also very serious matter, self-inflicted violence or indirect violence in adolescent group of uh, people. And this is just to draw attention, this was game, Blue Whale game, and Blue Whale Challenge it was called, is a social network phenomenon dating from 2016 that is claimed to exist in several countries. It is a game reportedly consisting of a series of tasks assigned to players by administrators over a 5 days period, initially announces before introducing element of self-harm and the final challenge requiring the player to commit suicide. So like this, in very beginning commands, they command to inflict self-inflicted injury with sharp cutting instrument on forearm like this. And finally, when adolescent boys or girl succumb in this command, then slowly they give some more serious command, and last 50th command is go to the height and simply jump from the height. So this is very serious matter. And as far as statistic from Russia, reported 130 suicide of children in Russia from November 2015 to April 2016. So this is very serious statistic. Almost all of them were members of the same group on the internet. And this is one case. In this the first 6 steps, step 1 was clap twice and say, I am very strong. Step 2, couldn't recall. Step 3, cow F15 on your forearm with a sharp object. But as soon as boy could complete her 6th step, it was noticed by his father that there is something going wrong with him. So boy was taken to psychiatrist for further treatment in AIDS, and with proper counseling, proper psychological sessions, he was out of problem because he had a curiosity. What come next in this challenge game? So this type of steps should be taken by parents and guardians only. And you should also see for behavioral changes of your children, symptoms of clinical depression, violent actions, rebellion, or running away, drug and alcohol use, symptoms that are often related to emotional state, that is headache, fatigue, pain in abdomen. So this kind of symptoms should be taken care by parents and guardians. Loss of ability to tolerate praise or rewards, because all this may turn into either violence to opposition or self-inflicted wounds, or in some of the cases up to suicide. As far as MPP Act and POXO Act is concerned, this POXO Act, that is Protection of Children from Sexual Offences Act 2012, and it was enacted in 2019 to make it more stringent. So this act particularly addresses to protect children from offences of sexual assault, sexual harassment, and pornography, and provide for establishment of special courts for trial of such offences and for matters concerned therewith or incidental thereto. So as far as this act is concerned, with child, any person below age of 18 is child, and this act is gender equal. It addresses problems of both male as well as female, and it addresses sexual harassment, sexual assault, aggravated form of sexual assault, penetrative sexual assault, aggravated form of penetrative sexual assault, and using child as a pornographic purpose. And there are provision of punishment, stringent punishment, ranging from 2 years imprisonment to lifetime imprisonment and in certain cases, even life sentence, death sentence rather, is also punishment in this act. So let us see certain situations where this type of problems occurs and they come under POCSO. A 17 years old girl comes with her boyfriend to a doctor and she asks for contraceptive advice. She asks to the doctor that we are going to start our sexual relationship. You please advise her contraceptive measures not to end up into unwanted or unplanned pregnancy. So what will you do in this type of situation? Can you advise? One side is your moral duty and other side is law. If one advises, then it becomes a case of abatement under POCSO Act 2012 and Amendment 2019 and Indian Penal Code section 107 to 120. And if one doesn't advise, then it is likely that she may end up into unwanted pregnancy. So this is tricky situation for doctor, for gynecologists. So what to do? So one can give them health education, but cannot prescribe contraceptive measures if she is less than 18. One more situation. 16 years old girl is brought by her mother with complaint of vulvovaginitis with discharge per vagina. Many a times there is no direct history of sexual abuse, uh, uh, sexual assault. But many a times you may uh, come to know by the history indirectly. Many times in this type of situation, a child is brought to you, and on examination, it is found to be case of sexually transmitted disease. So naturally, you should ask for history of exposure, and she gives many times gives history of sexual exposure with her boyfriend. So what will you do in this type of situation? Naturally, you treat the patient but inform police because it becomes a case under POCSO Act. One more situation. 18 years, 6 months old married girl is brought by her mother with pregnancy of 39 weeks and she is for lower segment cesarean section. So many a times, tricky situation. What will you do? Proceed with lower segment cesarean section if indicated, but inform police as at the time of conception she was minor and it becomes a case of rape even with consent, even with her husband under POCSO Act and under IPC 375. So treat her, of course, accordingly, but inform police in this type of situation. One more situation. 17 years old girl with mother visits hospital with 6 weeks pregnancy for termination of pregnancy. Doctor explained to inform police. Whenever this type of situation occurs, you will explain to the mother or any guardian who has brought a child to you that I will have to inform police. Of course, I will treat you, I will give you proper treatment, but I am under obligation to inform police. So many a times in this situation, patient and mother refuses for the same and leave your hospital without taking further treatment. So in this type of situation, what will you do? Inform police. Whether you treat that patient further or not, but when you come to know crime happened under a POCSO Act, you are under obligation to inform police. This is not true for only treating doctor. This is true for parents also, for guardians also, any neighbors also, any responsible citizen of India comes to know about the crime happened under POCSO or apprehension of crime to be happened, then also you are under obligation to inform police. Otherwise, it becomes an act of abatement. A person abates an offense who instigates, engages, or intentionally aids by any act or illegal omission the doing of that offense. And as far as Section 107 to 120 of Indian Penal Code is concerned, to instigate, to help, to encourage becomes a abatement under IPC. So by instigating a person to commit an offense, by engaging in a conspiracy to commit it, by intentionally aiding a person to commit it, it becomes a abatement. So if I go to my first situation, if you advise contraceptive measures, prescribe rather, then it becomes intentionally aiding a person to commit it. So, notwithstanding anything contained in Code of Criminal Procedure 1973, any person, including child, who has apprehension that an offense under this act is likely to be committed or has knowledge that such an offense has been committed, he shall provide such information to Special Juvenile Police Unit. Many times, if police do not entertain your complaint, then you can complain it in CWC, that is Child Welfare Committee. It is available in big town. So you are under obligation to go for that. And under section 19 subsection 1, it is very much mandatory to inform in this type of situation to local police. And section 20 says, when any person encounters with any material or object which are sexually exploitative of child, he is under obligation to inform police or CWC to inform. So in a situation of failure to report, there is a provision of imprisonment which may extend up to 6 months or fine or both of them. And any person being in charge of any company or an institution, then imprisonment up to 1 year. And this provision of subsection 1 shall not apply to a child. If child knows all this offense and he doesn't inform police, then he will not be treated under this act. There is one more provision in this act, and there is false complaint or false information. If anybody gives false information just to defame somebody, then there is also provision of punishment of 6 months of imprisonment. In this also child is exempted. And one more thing, false complaint or false information about child, not about elder person who is involved in this activity, but false complaint or false information about child by other than child, it is also punishable for imprisonment of 1 year with fine or with both. As far as MTP Act is concerned, abortion services are very much safe in expert hand, in government hospital, it is free, and all the information related to abortion services are confidential and it is not to be disclosed to anybody in public. So as far as MTP Act is concerned, very recently in this year only, there is amendment bill produced in Lok Sabha and yet it is to be passed in Rajya Sabha. Then it will go for signature of Honorable President and then it will come in Government Gazette and it will be amended as MTP Act. So in this Act, proposed amendment, there are some good provisions, good proposition given in this amendment. Previously, failure of any device or contraceptive measures were taken as an indication, but it was available for married woman only and with her spouse. Now in this amendment, it is a word is changed, any woman or her partner. So any unplanned or unwanted pregnancy can be terminated even for single or unmarried woman also, but of course under provision of MTP Act 1971. It is recommended extending the gestational period from 20 weeks to 24 weeks in special category. If certain anomalies are detected, up to 24 weeks, pregnancy can be terminated if this amendment is passed. And there is also one provision. If congenital anomaly there cannot be detected up to 20 weeks of gestation, then pregnancy can be terminated at any given gestational period, but it should be diagnosed by medical board. And medical board means gynecologist, psychiatrist, pediatrician from government, and 2 or 3 gynecologists from private also. And if their medical board is of opinion that this pregnancy should be terminated for the betterment of patient, then their pregnancy can be terminated at any given length of gestational age. And as far as confidentiality is concerned, abortion practices are very much confidential, and all the information related to patient should be confidential. And in this act, MTP Act, just now there is a punishment of only rupees 1,000 fine, but with this amendment, provision is made that if anybody reveal the information of patient as far as abortion services are concerned, there will be imprisonment of 1 year and even fine and both. Opinion up to 20 weeks of only one registered medical practitioner, more than 20 weeks and less than 20 weeks, 2 medical registered medical practitioner, and it will be they will be given opinion to terminate pregnancy. So if this amendment passes in government gazette, really indicated patient will have great relief. So carry home message, be watchful about activity of your child to avoid assault to your child or committing suicide in this teenage group. When minor is brought for examination and treatment for complaint about sexual abuse, responsibility of medical professional being an expert increases manifold. Responsible medical professional is under obligation to report to appropriate authority about any child sexual abuse he comes to know during his professional medical duty. He has not only to examine and treat the patient, he has to form opinion whether sexual abuse has happened, and he is very important person to be helpful as an expert witness to prove a crime of child sexual abuse. And of course, it is very important comply with the law of land. Thank you very much. I will be happy to answer any question or query if time and organization permits. Otherwise, we can take it at the time of panel discussion.
Thank you very much, sir. As usual, you were with wonderful statistics and case scenarios. It was really wonderful, sir, to have you here with us. We will take up questions at the end of the session, sir.
Okay.
Deepa, can we go on to the next speaker?
Yeah. Deval, can you share the slide of the next speaker? Since we are going behind time, I take just a few minutes to wind up with the introduction. The next speaker is Dr. Harish Pemde. He's a Director, Professor, Department of Pediatrics at the Lady Hardinge Medical College, New Delhi. He's a very renowned senior pediatrician with the national and international credit. He's a head WHO Collaborating Center for Training and Research in Adolescent Health. He's the in charge Center for Adolescent Health, Kalavati Saran Children's Hospital, member secretary, Institutional Ethics Committee at the Lady Hardinge Medical College, New Delhi. And currently, he's a joint secretary liaison of Indian Academy of Pediatrics 2020 to 2021. So he has given a lot of orations. He has done 45 research papers and written 15 chapters in books. I think he deals a lot with adolescent pediatrics. Even though he's a pediatrician, he'll probably be the right person to talk on life skills for our youth. Dr. Harish Pemde, please.
Hello. Should I share my screen?
Yes, sir, please.
Right. So here I go. And I must thank the organizer the Trichy of Skyny Society and Foxy, especially Dr. Deepa and Dr. Rosa for inviting me to this a very interesting kind of a seminar. I must tell in the beginning that my talk will not be having so much technical terminologies. It is more for the adolescents and then for the practitioners or doctors. But yes, as a doctor also, as an adolescent practitioner, he must also know about the life skills. Uh, just a minute. My computer's battery is creating some problem. Okay. So I would like to begin with this saying, which is a very, very old one, but I want to use it for adolescents and for children. The Gabriel Mistral said about 70 years ago that we are guilty of many errors and many faults, but our worst crime is abandoning, you can read, the adolescents, neglecting the foundation of life. Adolescents are the immediate foundation of adult life. Many of things are we need can wait. Yes, the children cannot wait. And adolescents also are forming their attitudes, their personalities, their career, and they are also developing. So we cannot answer tomorrow, his name is today. So we cannot answer tomorrow as adults, we must answer adolescents today. So friend, life skills are nothing but the abilities or our behaviors for adaptive and positive behavior that enable individuals to deal effectively with the demand and challenges of everyday life. Dr. Roja and Dr. Patel has told you so many things about your behavior, sexuality, pregnancy, abortion, contraception. These are all results of some behavior which may or may not be accepted by society, but yes, these are the various behavior. And life skills tell us how we can adapt and how we can go for positive behaviors. So adaptive means person is flexible in approach and is able to adjust to different circumstances. Positive behavior implies a person is forward looking, finds a ray of hope in every situation, finds solutions and opportunities even in difficult situations. So knowing about life skills, we can deal with difficult situations. There are various types of skills we are aware of. One are life skills, which I will tell in some more details. But there are sometimes livelihood skills like time management, getting a job, computer, cooking, driving, practicing as a doctor also is a livelihood skill. Learning skills, reading, reporting, using computer, okay, and technical and health skills, cleaning tooth, using condom, road safety, giving oral rehydration or taking some medications. And the outcome of all these skills is maybe a teamwork and a good self-esteem and learning from each other, confidence, etc. These are the various skills we need to learn. And as adolescents, briefly touched by Dr. Roja also, adolescents have lots of exploring self and identity needs. They question themselves, who am I and how am I developing? They explore various identities, their personal identity, relational identity, vocational, spiritual, ethical, and sexual, and romantic identities with themselves. They also need autonomy and monitoring and support also. Lot of things they have about acceptance from self and others. They want to be accepted as their own with their own identity. This is, you can say, leaving the childhood behind and leaving the parents' name behind. So their issues comes of self-esteem, and here comes the parent-child conflict also. And various mental health problems also begin during this age. So they require lots of skills to be learned, and they need these life skills for exploring various alternatives, weighing pros and cons in various situations, making rational decisions, effective communication, and assertiveness. As mentioned by Foxy President also, saying no is a very, very important skill all of us must have. Some details about the various skills. I will go in some details. So these are the skill domain these are the communication and interpersonal skills. So interpersonal skills are related. Ones are verbal and non-verbal communication, and we are communicating with you. It is mainly verbal communication, but through our body language, our videos, you can see the non-verbal communication also. Then expressing feelings, giving, receiving feedback. Yes, you may be asked to give some feedback after the session. Negotiation and refusal skills are a very, very important ones. In various situations, we need to negotiate and do some conflict management. Assertiveness skill, assertiveness for our rights, for our things which we need to have. And refusal skills are very, very important skills, like saying no, how to say no to our friends, how to say no to our good friend, personal friends, girlfriend, boyfriend, and other. Empathy is also a very, very important life skill. Empathy is ability to listen and understand another's needs and circumstances. Express and also express that understanding. Just understanding is not difficult. We must also express that understanding. Other communication skills are cooperation and teamwork and advocacy. We must express respect for others' contributions and different styles. See, human being lives in a society, and most of us work in teams. We must learn how to express respect for others and their contributions, and in assessing one's own abilities and contributing to the group. For advocacy, we must know influencing and persuasion skills, networking and motivational skills. These networking skills are becoming very, very important nowadays. Another domain is decision making and critical thinking skills. So decision making skills are very, very important one. This include information gathering skills, evaluating future consequences of present actions. Here, I would like to say that adolescents and youth, they are not designed to understand future consequences of present actions because their brain is not developed. The final and complete development of brain occurs around 24 to 25 years of age. Then only they can understand the future consequences of present actions. Otherwise, they are not able to think about future consequences of present action. This is a very, very important thing we all need to understand. And that is why adolescents, they need monitoring. That is why adolescents need guidance from parents, teachers, doctors. Then determining alternative solutions to any problem and analytic skills. These analytic skills develop during the, you can say about after the adolescence. The full development of analytic skills occur after the adolescence because then only they can understand the future consequences of present actions. The critical thinking skills are important. It is for analyzing peer and media influence. Lots of media is focused to adolescents and youth. They are giving so many messages about diet, so many messages about the body image, and these are very, very difficult to understand the real motto, real goal of those companies who are making these messages. So this is a very, very important skill we must understand. Then analyzing attitudes, values, social norms, beliefs, and factors affecting those. Identifying relevant information and information sources. Lots of information is available nowadays. The whole internet gives you a big amount of information. So it is a very, very important to find out which is the relevant information, which source is good, which source is authentic, then only to rely on those information. Then coping and self-management skills are also important, like increasing internal locus of control is a sub-skill. So self-esteem, confidence building skill, self-awareness, goal setting to make career, self-evaluation, self-assessment, and self-monitoring skills. Another things are managing feelings. So anger management, stress management, dealing with grief and anxiety. See, we all can very well deal with success, but dealing with failures is also very, very important. Today, we may are going to have a celebrity who became a celebrity, but I am sure she must also dealt with very nicely with several failures before she became a successful celebrity. So these are the 10 core life skills given by WHO. So how does this training in life skills benefit young people? We can learn these life skills, and training definitely benefits young people. It helps them to develop self-confidence, successfully deal with second significant life changes and challenges such as bullying and discrimination. This bullying is becoming very common. It's a new form. It is coming as a cyber bullying and in various other forms. And discrimination also we can deal if we know the relevant life skills. It gives them a voice at school, in their community, and in society at large. It enables them to make a positive contribution to the society by developing the expertise and experience they need to claim their rights. Okay, if you don't claim your rights, people can exploit you, and understand their responsibilities while preparing them for challenges and opportunities of adult and working life. That is what I said, that we have to address today's adolescents so that they become a responsible citizen, responsible adult during their working life. So areas of primary prevention for which life skills are considered essential. Now you can understand that why did we talk of the violence, child abuse, pregnancy, substance abuse in earlier topics. And through learning the life skills, we can prevent ourselves from violence, child abuse, and various kinds of substance abuse, even from suicide, adolescent pregnancy, HIV, AIDS, and various kinds of injuries. Dr. Roja mentioned very briefly about non-communicable diseases. So yes, injuries and accident we can prevent if we have learned the life skills. This story all of us know. For the sake of time, I will not read this part of the story, but I will go through the description of the story, that how Crow used these life skills. So Crow was thirsty and knew he was thirsty. When he saw the low level of water, he felt disappointed and knew he was feeling disappointed. So he badly wanted to drink the water. So the skill of knowing oneself is called self-awareness. He was self-aware that he needs some water. So why was the crow disappointed? Because he knew that he would not be able to reach and quench his thirst. This kind of analytical thinking is called critical thinking. So he used critical thinking to find the reason for disappointment. So what the problem was, crow was facing in drinking the water in the pot, he could not reach it as its present label. He couldn't overturn the pot or break it. This is an example of critical thinking for problem solving. So he knew what he is not able to do. This is also an life skill. So what did the crew do to find a way out? He kept thinking and applied his mind to find a new way to drink the water. He thought of using stones to raise the water level. This is one example of creative thinking. And to solve the problem, a skill of problem solving. So he decided to use the skill of decision making. So in one ad, he used so many life skills and ultimately he succeeded in drinking the water. So decision making helps us to deal constructively with decisions about our life. We can also similarly help ourselves in difficult circumstances. And this can have consequences for health if young people actively make decisions about their actions, whether it is related to their health, and they can assess different options to them. And this decision making skill is a very, very important one. So these are the 3 C's in decision making. So we have to find out what the challenge is. So decision which we are facing, then we have to find out various solutions. So what may be the choice 1, choice 2, and choice 3, or even more. Then for each choice, we have to find out pros and cons. What if I choose this? What are the benefits? What are the disadvantages? So of each choice, or what may be the future consequences of each choice. Then depending on the best choice for that time, we can choose that. Okay. So this is the method of decision making. This is a process which we all can learn and use this in difficult circumstances. So first of all, we have to think about the situation, then seek advice from others or find more information, listen to the advice given, pray to the God that you are successful in this decision, consider family values and personal values or societal values, cultural practices and religious beliefs, consider all of the options or alternatives available to you, imagine the consequences and possible outcomes of each option, then consider the impact of actions on other people, choose the best alternative, make the decision, act on the decision, and most importantly, accept responsibility for your decision and your actions. So these are the steps of decision making. If we know it, we can learn about it, we can make responsible decisions. So decision making is required for setting life goals, for choices. It may be as easy as food habits and other hobbies or lifestyle, or it is related to your substance abuse and choice of profession. So we have to learn the responsible decision making, and this is making decision after examining the choices and consequences in view of one's values, opportunities, limitations, and goals. And this is known as responsible decision making. So, friends, we all can learn how to make responsible decisions. So it was not possible for the given time to teach each and every life skills, but there are various things available to learn these life skills. Your friends can teach you, your teachers can teach you, your parents can teach you, and we doctors can also teach you these things. So life skills are very, very important for all individuals, including doctor, parents, teacher, and youth. Life skills help in different and difficult situations. Life skills can be learned. Very important factor. We all can learn these life skills. And at the time of distress, adolescents and youth may not use life skills appropriately. So whenever you are distressed, think about it, use those life skills, and you will definitely come out of those difficult situations. And definitely we can help each other learning these skills. Thank you, and I will be happy to answer some questions if they are there.
Uh, Thank you so much, sir. Perfectly said. Life skills are the ones that are going to shape the children for a better future, for handling adversities and everything. So it's so important. I think the thing you mentioned, that critical analytical thinking and realistic expectation of what one's capability is. I think the parents have more to do nowadays. Their expectations are so high. I think that's what drives the children mad. Possibly the parents are all the time over enthusiastic, and they have unrealistic expectations from their children, and they always compare with the peers, children or something. So very, very beautifully explained, sir. Thank you so much. I think it's time for the next talk. Vidya, can you
Yeah.
introduce our next speaker?
Yeah, next topic is going to be a very interesting one because it's about something which is happening very commonly among the youth. It's the internet and mobile addiction in adolescents. I invite Dr. Om Sai Ramesh V to give a talk on this. He is MBBS, DPM, PhD in Child and Adolescent Psychiatry, NIMANS, and he's an Associate Professor of Psychiatry, Lady Hardinge Medical College, Ministry of Health and Family Welfare, Government of India, New Delhi. Sir, over to you, sir, to speak on addiction, both mobile and internet addiction among the adolescents.
Thank you, madam. Thank you for nice words.
You can share your screen, sir.
Is it seen very clearly by everybody?
It's seen.
Yeah.
It's seen.
So, very good evening to all of you. At the outset, I would like to thank Dr. Harish for roping me into this particular group, and I'm thinking that I'm very fortunate to be amongst you people and share some of my experiences. I'm thankful to Dr. Vidya, Dr. Deepa, Dr. Roja, and the topic which I have chosen to talk today is very interesting, I know, and it is really a challenging phenomena too. So, do you play video games on the internet or mobile in excess? Are you compulsively shopping online? Can't you physically stop checking Facebook and WhatsApp? Is your excessive computer use or mobile use interfering with your daily life, such as relationships, work, academics, school, etc.? If any of the participants are thinking the answer for one of these four questions is yes, probably you are listening to the appropriate lecture. So, let's talk about this internet and mobile addiction in adolescents. And my presentation would be in the following headings. I will try to introduce the topic, and then I also would like to tell why adolescents are more vulnerable. And I will also talk about the different kinds of presentations, diagnostic criteria, and what could be the reason and causes for such kind of conditions. And a little bit of specifics to internet addiction and internet specifics to mobile addiction. And then probably warning signs are going to be there. And we'll talk about some of the treatment options and preventive measures. Well, in the recent times, the term addiction has been expanded beyond the substance dependence. So till recent, we were talking about, alcohol dependence, cannabis dependence, such kind of dependence patterns have been talked, studied, presented, discussed. Whereas now we have another category, what is called as non-substance related behaviors. This is basically related to the process of behavior, how you take the kick of it. That is more important than the kick what is given by the substance. So this addiction to a substance or a behavior may look similar in their effects on behavioral patterns, emotions, physiological changes. The first type, the substance addiction, involves direct use of substance, let's say alcohol, ganja, heroin, weed, etc. The second type, behavioral addiction, comprises of potentially pathological behavior. The process how you do that, to which a person may achieve pleasure and become dependent on that particular behavior, and he tends to do it again and again. There are several types of behavioral addictions, which ranges from technology oriented, like such as internet use, mobile use, gambling. Somebody can have addiction towards very specific behaviors like sexual behaviors, exercise. Somebody can be getting addicted to work or shopping, etc. For the last 2 decades, the internet and mobile use have grown very rapidly, and they have become integral part of all of our lives. And they became important tools for education, entertainment, communication, information sharing. The increasing popularity and frequency with which we use the internet and mobile has led to the emergence of very many clinical conditions, presenting with either in the form of abuse, misuse, overuse, which leads to this particular group of conditions which we are talking today, internet and mobile addiction. There are many terms which are used in the literature, and more or less most of the things would be saying the same thing, like internet or mobile addiction disorder, pathological internet use, mobile use, problematic internet or mobile use, excessive internet or mobile use, internet dependence. So virtual addiction, this is a term which recently has been added. So there are so many words which tells the same phenomenon. How common are they? Various studies have reported wide range of prevalence rates for both the conditions, internet addiction as well as mobile addiction, ranging from 2 to 25% of general population. But however, most of the authors are agreeing to the common figure, that is prevalence rate of around 10% of adolescent population may be having internet addiction. When it comes to the mobile addiction disorder, the prevalence ranges between 10 to 40%, 48% of the population. Then recent studies report a median prevalence rate of around 23% of amongst children and adolescents. There's a recent publication which talks about this and tells us how this particular problem is prevalent in the group of adolescents. Another recent publication from India tells that it is around 24.65%, which is very, very alarming and which has to be taken seriously. Why adolescents are vulnerable? why are we discussing about adolescents? Why are they special? They are special because their educational needs are different and their career pressures are different when compared to the adults. And at that age, they are more driven by identity seeking, social recognition. They want to know that they have to be known, they have to be recognized, they should be liked by more people in the Facebook, WhatsApp, etc. And they also have the ability and accessibility to the technology. When compared to the others, the younger population are well equipped to use the technology. And they also have this pleasure-oriented approach when compared to the adult population. They also are very novelty-seeking. They want something new every time. And they can also take some risk-taking behaviors. And they don't mind if it is not very safe, but still they do that. That's what is called as risk-taking. And the most important thing is the peer pressure. They do not look at the adult in the how as their competitors, but they look at the people who are around as friends, classmates, peers, and they compare with them and they take the pressure from them and they go into the competitiveness with them. And another important reason why they are important is that they also have little impulsivity. And as we all know, the development of emotional, social, cognitive domains continues up to the age of 25 years. So the adolescent group is still having the development taking place. So therefore, they are more vulnerable for this kind of disorders. What are the presenting symptoms? How to pick them up? The most important hallmarks of this addiction disorders are these four things. First thing is usage, which is in excess, either in the internet usage or mobile use. It is excess. And you also develop what is called as withdrawal phenomenon, meaning that without that particular use, you can't stand still. That is what is called as withdrawal symptoms. Then you also develop what is called as tolerance, meaning by playing, let's say 10 minutes, 20 minutes, you will not get the same pleasure which you got in the initial stages when you played for 5 minutes. You need to increase the time again and again. That is what is called as tolerance. And then, of course, you do have negative repercussions of this particular behavior in all areas of life, like personal, social, occupational. In general, anything which gives you stimulation in life is being liked by us, and we prefer doing it again, and we may make it as a habit. But once you have obligations to do it again and again, then it becomes addiction. There are certain physical symptoms which are very well associated with this technology-oriented addiction disorders, such as backache, carpal tunnel syndrome, headaches, insomnia, poor nutrition. Either they eat less or they eat more, or they eat while using the net or mobile. And their poor personal hygiene is very much markedly seen. Neck pain is the common problem which is being complained by the people who are addicted to either internet or the mobiles. Dry eyes and vision problems, weight gain, weight loss. These are the physical symptoms. There are certain set of psychological symptoms which you may come across. They may be depressed, they feel guilty, they're anxious, they feel euphoric. That means they feel ecstasy while using the net or mobile. They cannot prioritize or keep schedules. They isolate themselves. They have a sense of, they do not follow the schedules, timings. They become defensive. They avoid work. They become agitated. Mood swings are very common. They become fearful, lonely, boredom. These are the kind of problems, and they procrastinate the things very often. These are the psychological domains which you will cover. What are the known causes for such kind of disorders? Like most other disorders, exact cause for internet addiction or mobile addiction is not clearly understood. However, these disorders are having multiple contributing factors, which can be these are very well studied and documented. Biological factors such as brains of these populations seems to be almost similar to those of people who are having substance dependence, such as alcohol dependence, heroin dependence. So probably there is a biological factor which is playing a role. And their prefrontal lobes, which are very much important in execution, also show some abnormalities. So they may not be able to execute well and plan well. So therefore they'll land up in problems. And then we all know that there is something called as pleasure center in our brain. And we know the pleasure pathways. And we know that levels of dopamine, serotonin, which are low in these kind of population when compared to the other population. Then there are a set of psychological factors, variable reinforcements. Whenever somebody is going online and doing some shopping or playing games on mobile, they do get reinforcements, meaning rewards, meaning that they get excitement whenever they want to see something new. For example, if I log in onto my Facebook today, I'll get to know something new today, or I will get another reward, like I will share something new with others. This kind of rewards are always associated with repeating the same behavior. And of course, there are some predisposing conditions such as anxiety, depression, which may land up in this kind of conditions. And lastly, the personality traits needs to be kept in mind. We have observed in our clinical setup that most of the children, adolescents, who are little shy, who are little asocial, land up in this kind of problems more often when compared to others. And then last but not least, the environmental factors. You shouldn't forget. Mostly you will find somebody who would be, role modeling, and probably it is a wrong role modeling which is happening at home. Maybe the elders, maybe the neighbors, etc. And of course the peer pressure. And most important thing is the media, both media as well as social media influence, which would be playing a major role on adolescents. This is what is called as reward pathway, which involves both dopamine as well as serotonin. Little specifics to the internet addictions. Internet addiction disorder refers to the problematic use of internet, including the various aspects of its technology, such as emailing, using www, World Wide Web. It has been formally recognized as a disorder by APA. It's an addiction that closely parallels with the addictions otherwise, like drug abuse, such as alcohol addiction. What are the signs of internet addiction specifically? You check your email very often, every 5 minutes, and spend more time in chat rooms than in living rooms. Your relationships suffer because of this usage, and weak relationships are the sign of internet addiction. Sometimes your family and friends complain most often that you are spending more time with them. You hide the amount of time you spend on internet. You hide the websites which you visit. Secrecy is the sign of internet addiction. You use your computer to escape from the problems and the real-time situation. You have a hard time staying off the computer. You feel preoccupied by the internet when you are not on. These are the signs of internet addiction. And there is one very well-known diagnostic criteria called as Bird's diagnostic criteria. It says that the person is preoccupied with internet, needs to use internet with increased amounts of time again and again to get the same side of satisfaction, has made unsuccessful efforts to control, is restless, moody, depressed when it is not possible, has stayed online longer than originally. And one amongst these three things also is expected. They spoil their relationships or job or work or academics. They keep telling lies to the family members, or they use internet as way of escaping from the routine investment situations. There are some subtypes of internet addiction, like cyber sexual addiction, pornography, viewing or downloading, cyber relation addictions, using certain websites and certain platforms to develop relationships, net compulsions, buying, gambling, information overload, excessive web surfing and getting information, and gaming addiction as told by Dr. MC. Specific to the mobile addiction. Mobile usage has been most challenging epidemic in the country in the century. Its usage is like using a two-edged sword because it has both positive as well as negative consequences. adolescents are vulnerable, most affected. What are the symptoms? Reaching out to the mobile, the first thing right after getting up from the bed, using your mobile whenever you are bored or having nothing to do, becomes anxious when your mobile is out of the sight. Other people complain that you are using mobile phone more often, spending more time in using the mobile, fail to cut down usage. This is a two-edged sword, I just said. It can be a bless, it can be a curse. It seems that 89% of the students reach for their phone within 15 minutes after waking. 67% of the mobile owners find themselves checking their phone for messages, alerts, calls, even when they are not having any ringing or vibrating phone. And how do you feel when you misplace your phone? 73% get panicked, 14% get desperate, 7% get sick. So these are the kind of emotions which are attached with this kind of behaviors. It seems that in US, 55% of the people use mobile phones while driving, which is very, very alarming, which is very, very dangerous. So, as somebody said, if technology is getting smarter, does it mean that humans are getting dumber? So we need to think about it. We need to be watchful. We need to be mindful about this. What are the warning signs? Are there any red flags to keep in mind? Yes. If you check your mail or Facebook or WhatsApp within 10 minutes after getting up from bed, you need to be careful. If you start feeling sad or bad or irritable when you are not having the accessibility to technology, you have to be careful. If you meet with accident while walking or driving due to the internet or mobile usage, be careful. If your relationships are impacted because of the usage of the net or mobile, you should be careful. See, the most important thing is that the adolescents are using this while having their, their personal life, relationships, and work atmosphere also affected, but still they do continue to have this kind of, usage. The reason being that it is so-called addiction level. So, are there any self-assessments? Can we do something which quickly tell us that we are in a dangerous level? Yes, there are. This is one example. There are so many, but this is something which I picked up from my own understanding, which is very easy to understand. Smartphone addiction scale. It hardly takes around 4 to 5 minutes to do this. It is self-reporting. There are 10 questions, and it tells you where you stand. And there are so many other tests which are available, like internet addiction test. Young's is the most popular internet addiction questionnaire, internet addiction scales. Probably, I recommend that most of us should administer these scales, or we should do these self-reporting scales sometime and understand where are we standing. Are there any treatment options which we can mention today? Yes. When we say that it is a disorder, and when we say that it is a little above than normality, and then when we identify it and diagnose, then yes, we can offer even the treatment. Now, these are the certain things which we can practice and help the individuals who have this kind of problems. You need to practice the opposite. You need to identify the external stoppers. Are there anybody who can help us, like how much time we are sitting in front of the computer? And you set the goals, both short term as well as long term. Why are we getting into the Google, and what is the purpose? You need to know, and what is your goal, and you also should have long-term goals, and you also should learn abstinence, meaning like you do when you want to get out of the alcohol, how you keep yourself away from the alcohol. You should try that with this technology, and there are certain reminder cards which are available these days, which reminds you that you need to stop. Get involved in new activities, innovative activities, attractive activities. Get into some support groups and go for some family therapy. Yes, small percentage of them would be requiring pharmacotherapy, meaning medication. Capsule fluoxetine is supposed to be one of the very well tested, and it is showing good health, good results in persons who are having this kind of disorders. There is something called as digital detox. What is this digital detox? We do talk about detoxification when we are having somebody who comes to our clinic with alcohol dependence. We say that, you go for detoxification. What is digital detoxification? It is simply abstaining yourself from the technology. While you do that, you have to be realistic in planning. You should not be completely abstaining from the using, net or mobile, which will not be a correct option. But then you should know you should optimally use it. You should rationally use it, and you should set limits. Especially like example, like while eating, while doing your project, you should not be something like that. And you should remove the distractions which are associated with this. Most of the the apps and all those things will have what is called as, they give a ring whenever there is a message. You can keep them in silent mode unless until it is not necessary, essential. Make it work for you rather than you work for it. Share your plans with your family and friends so that they help you, and they help you to be abstaining from this usage of technology. Try to find alternatives like exercises, yoga, walk, read, etc. Are there any preventive methods which we can use? You should become, first of all, be aware about these kind of entities, that there are something called as internet addiction disorder or mobile addiction disorder. You need to know what are their features. You need to know what are the warning signs, and then be watchful, not only in you and also in your own wards and family members. Look for the role models, wrong role models around, and keep them away. And don't ban internet and mobiles completely, because this will create more problems. So therefore it is better to use optimally. Place the computer at a common place rather than in a privacy. Optimize the accessibility to technology. External internal checks. Nowadays most of the technology, most of the computers are having certain apps and certain devices which tells you how long you have been watching the screen. Will tell you. So these kind of things needs to be explored. Look for and ask for help. Do not hesitate. So just to conclude, I would like to say internet and mobile addiction disorders are being a new challenge to the adolescents. Optimal and meaningful utilization of technology is always warranted. Adolescents are vulnerable to these conditions because of biological, psychological, and environmental reasons. Adolescents should become aware about these conditions and take appropriate measures to avoid them. Adolescents with these conditions can be provided help by family, friends, therapists, and mental health. The quality of life of adolescents and their family members can be improvised with a comprehensive biopsychosocial intervention. Thank you.
Thank you, Dr. Homsai. Are you able to hear me?
Yes, madam.
So it was really a very clear and crisp talk. And as you said, it's a blessing. I mean, it's a double-edged sword, having a bless and a curse. And I think by looking at the symptoms, not only adolescents, we too have symptoms. Yes. And like social media has really spoiled our, I don't know, we are also addicted in poses, selfies at all conferences and putting it in social media. I think
very correct. Very
we
correct.
all have to accept that we do suffer from all that. So I think it was a clear and crisp talk, sir. It would have gone as a good reach to the adolescents. They will not have any questions about this. So clear. Thank you so much, sir.
Thank you.
Deepa, are you here?
Yeah. So like Vidya said, just to add a few things, I think we are all addicted, sir. We all need the addiction. I think probably the parents are the best teachers for the children. I think if we refrain from using mobiles, they might start looking at us. And, those days we were encouraging children to go out and play, engage in dance and other extracurricular activities. But now all these have come to a full stop. It's all about previously it was television. Now everything is available. Even the TV is available on the mobile and the internet. So it's just the phone and themselves. That's all. So it's actually seems to be a bad trend, but I think we need to talk more. Very beautiful talk. Thank you so much, sir. With this, I request Mr. Karthikeyan. Is he here? 1 second. Our next speaker, sir.
Yes, ma'am.
Yeah, with pleasure. I invite our next speaker. Can I have his slide, please, Gaurav? Yeah, Mr. Karthikeyan is yet another wonderful specialist in cybercrime. He's a certified cybercrime investigator. He's a certified cyber forensic analyst. He's a certified international cyber law practitioner. He's had various courses and trainings and been involved with the International Bar Association, London, England, and Wales. He has gained rich experience from the barristers and solicitors practicing in the Royal Courts of Justice, England and Wales. He is an official guest lecturer on cyber crimes and cyber laws at Tamil Nadu Judicial Academy, Tamil Nadu Police Academy, and the National Academy for Customs, Indirect Taxes, and Narcotics. So he is probably the right person to talk to us on this topic of cyber crime against women and cyber stalking, the much needed topic for all the women, not only the adolescent and the teenagers, it's also for all women of even elder age groups. So please welcome and move on with your talk, sir.
Thank you, ma'am. Thank you so much. Thank you for the panelists, and I personally thank Deepa madam for giving me this wonderful opportunity. It's a pleasure meeting all on this wonderful evening, and today we are here to discuss on various aspects of cyber crimes, especially like cyber stalking and like concentrating on adults and adolescents. So to put it in a single nutshell, like the panelists here are called digital migrants, and the listeners and the participants are called digital natives. So as digital migrants, we know the difference between the real world and the virtual world. But whereas the digital natives know only the digital world, they can't, they are not in a position to differentiate the difference between the real world and the virtual world. So as digital migrants, when we were adolescents, we have been governed by the words of our parents, relatives, and elders. But today's adolescents are governed by artificial intelligence and robots. It's as simple as that, nothing else. So we have to look into the various aspects. And first and foremost is the cyber civilization. First, we need to discuss on the cyber civilization. We call ourselves a civilized society, but like when it comes to online, we forget everything. What do you mean by civilization is nothing but through thousands of years, we have learned a set of empirical codes that govern the human civilization. We call it as a set of empirical codes known as etiquettes. But when it comes to online, we forget everything, and we literally we behave like nomads. We go wherever we are in the cyberspace, irrespective of whether it is safe or not, whether it is safe to share things or not, even to the photograph. So it's order of the day, and left with no other option to learn a set of empirical codes that is called as netiquettes, the do's and don'ts in the cyberspace. So that's the only way how we can safeguard ourselves. So we are always thinking about security means it's only the physical security, but we need to concentrate on cyber security as well, because the threat comes from a different angle. Physical security, like we are bothered only about like our residents or in the clinic, wherever the doors are properly latched and we have a security gates, and that's it. But the threat comes from a different angle when you connect yourself to an internet, either through your mobile phone or a laptop or any other digital gadgets. So we need to concentrate on a different angle. So the new age threats are nothing but internet addiction, cyber relationship addiction, net compulsion, information overloaded, and computer addiction. So cyber addiction is nothing but we are always addicted to any kind of digital gadgets. Look, it may be a palm top, it may be a tablet, or it may be a smartphone. In spite of that, like we are thinking only about the hardware. Think about the softwares inside that. If you own your mobile phone, normally you have about 30 to 40 applications into your mobile phone. How many of the mobile applications are purchased by you? You would have downloaded several hundred mobile applications. How many applications has been purchased by you? Have you ever thought of that? Why these mobile applications are offered at free of cost? Because to develop a mobile application, the development company has to spend crores of rupees to develop an application. But they are offering this application at free of cost. You never pay a single penny to them. Have you ever thought of it? Why it has been offered at free of cost? You would have under the impression they may make revenue out of some sort of advertisements. There are several mobile applications where you can't see a single advertisement in it. You use WhatsApp. Have you seen any advertisement in WhatsApp? You used to send text messages, video calls, everything. But you don't pay a single penny to them. So when we normally use a mobile phone for sending a text message, we call it as short messaging services, SMS, or sending a MMS services. They charge for the services which they have been provided by the network service provider. But when it comes to WhatsApp, we never pay anything. Have you ever thought of why it is offered at free of cost? And the company that owns WhatsApp is nothing but Facebook, and the founder of Facebook and CEO is nothing but Mark Zuckerberg. He's the top 5 billionaire in the world. He's the top 5 billionaire in the world, but you're never paid him a single penny, either to open an account in Facebook or to use the WhatsApp application. Have you ever thought of it, why it has been offered at free of cost, and what is their revenue model, and how do they make money out of it? We would have used several mobile applications into our mobile phone. While installing a mobile application, it demands for an agreement. It is called end user license agreement. Simply we click I agree, or simply we click yes, please install, that's it. Have you ever read that agreement? No. 99.9% of the person who are all downloading the applications, mobile applications, or opening an account with social media or social network sites, never read that agreement. It's an agreement between you and the mobile application developer. Normally, before signing an agreement, any sort of agreement, it may be a rental agreement or it may be a sale deal, whatever it may be, we used to read each and every line. But while entering an agreement with a mobile application developer, we not even bother about reading a single sentence in it. But each and every application has a particular clause, we call it as a particular paragraph in it. It says that when you install your mobile application into this mobile phone, will gain access to your contact list, will gain access to your mobile phone gallery, will make use of the photos and videos stored in the mobile gallery, will gain access to your mobile phone cameras, will gain access to your mics. And it further goes down and says that we will listen to your mic and will record all your conversations, whether the application is in use or not in use. We will listen to all your conversations and will record all your conversations. And it further says that we will turn on your cameras, will take pictures and videos whenever required. And it further goes and says that we will make use of these photographs and videos taken using your mobile phone for our commercial purpose, or we sell this to third parties, not any companies. So what happened in Cambridge Analytica and US election? In US election, like everyone was under the impression that Hillary Clinton will be the next president. But surprisingly, when the election result came, it was Donald Trump. And subsequently, an investigation was conducted in that. And it was revealed a company called Cambridge Analytica was involved in that. And when Cambridge Analytica was called, it says that Facebook had given all this information to us. And when Mark Zuckerberg was called by the senators and he was interrogated for more than 10 hours before the Senate, both senators and congressmen interrogated him. He said that we have explained all these things in our agreement. It is the duty of our user to read that agreement, because ignorance of law is not an excuse. He clearly says to the Senate that we have mentioned that we will make use of your cameras to take pictures and videos, and will share this, you are including your personal character and behaviors to third parties for commercial purpose. Please agree for that and open an account with Facebook. If you're not agreeing for that, please don't open an account with Facebook. This is what the statement given in the Facebook end user license agreement. So simply he came out of this interrogation and he was, he was not convicted on this case. The same thing applied to Google as well. Sundar Pichai was also interrogated for more than 10 hours before the Senate for accessing each and everyone's location. And he also stated the same. We have already given this in our agreement. Every user has entered an agreement with us. They've already read the contents of the agreement and they agreed. So what we are doing right now is that we are getting a mobile application in exchange of our privacy. In exchange of our privacy, of course. When you use any of the mobile applications or when you open an account with social media, you are exchanging your privacy. Your camera works 24/7. Have you ever thought of it? Have you ever heard of it? Simply you can go to the agreement, end user license agreement, and you can see that it says your camera works 24/7. Even if you turn off your mobile phone, your camera and mic will work 24/7. You can try this. For example, if you have a an application called Alarm in your mobile phone, Set an alarm for 5 o'clock and turn off your mobile phone. Exactly at 5 o'clock, it will start ringing. Exactly with the same tune that you have set for alarm, it will ring and your mobile phone will turn on. How does it know? So it works 24/7. For example, the other way around, you can also try this. Charge your phone with 100% and turn it off. Open in the, like maybe before going to the bed, turn it off. Next day morning, just turn on your mobile phone. The battery will be drained. Yeah, about 20 to 30% of a battery would have been drained because all the applications run even the mobile phone is turned off. Mobile phone is turned off is nothing but your on-screen icon displays, disappear from your eye. That's it. One more thing is, when you install an application, your mobile phone application into your mobile phone, you can never uninstall an application. Even if you click uninstall, only the on-screen icon will disappear, but the application will be there in your mobile phone. Just think about it. To download and install an application, it takes minimum 1 to 2 minutes to download and install an application. But to uninstall an application, instantly it will get uninstalled. Just a second. Within a second, it says that uninstalled. That's it. So what it does is just deleting the icon. Just deleting the icon, not the application. So even if you uninstall the application will run 24/7 and listen to your mics and what are the activities you are doing. Because I've seen a lot of cases, especially youngsters such as teenage girls. They use their mobile phone in the washroom and the bedroom and so many areas where these areas called private areas. They take their cell phones over there. So just think about that. You have about 40 applications. All these 40 applications are accessing your cameras. If that is the case, 40 different companies are watching you. Just think about it. Are you safe enough in this world, in the cyberspace? This is one side. And the other side is that you are sharing your own photographs in social media. You're sharing your own personal information in social media. We'll get into that. So that's called cyber relationship addiction. When you use a mobile phone, you're using applications and the applications are consuming all your private data. But when you open a social media account, when you open an account in social media, social networking sites such as Facebook, what are the informations you're giving in that? You're giving your date of birth, you're giving your mobile number, you're giving your email ID. After opening an account in Facebook, you're giving your personal details such as your place of birth, your hometown, and where you've done your primary school, secondary school, and UG, PG, and last year where you went for, which country you went for on a vacation, and the restaurants that you regularly visit, and the cinema theaters that you regularly visit. All these things are updated in social media. Is there anything called personal apart from that? Is there anything called personal? You too share your photographs, including you connect your family members as well. This is my mom, this is my dad, and this is my siblings. Your family, entire family tree is there in your Facebook account. Just think about it. This is just a social networking site. It's not social service site. They are not doing any social service. And why do you want to pull out all your family members into that? And apart from that, there is only one exception, that Facebook doesn't know about your character. That was previously prior to 2017. And post 2017, Facebook had started studying your character as well. Previously, you were given only your personal data, and subsequently, they've started reading your character as well. Way back up to 2015, there was only one button in Facebook which shows as a like button. If you like something, it either it may be a photograph or video. If you like something, you will click like button. If not, you will ignore it. Facebook want to study your character. So that is the reason in late 2015, they introduced 7 different emojis. So accordingly, you can express, your feelings by way of emojis against the photographs or videos that you have been seeing. So accordingly, they started reading your character. And in the late 2017, it's not enough for them because, people also becoming lazy. They don't want to search for an emoji and, accordingly click the emojis. So in 2017, they released another artificial intelligence in Facebook. It says that normally about 9 out of 10 uses Facebook only in mobile phone, not in laptops. So when you see something, when you see something in your Facebook, through your mobile phone, and if you like some photographs or videos, just you are staring at it and started smiling, then your smile will be captured by Facebook. Your smile will be literally captured by Facebook because Facebook accesses your mobile phone cameras and it's synchronized with your data. Accordingly, it captures your behavior. So what is your expression for a particular photograph? Irrespective whether you click like button or you post any emojis, your emotions will be captured through your cameras. Facebook, that's why Facebook, the founder of Facebook, Mark Zuckerberg, is a top 5 billionaire in the world. There are other, the Facebook has different, services in it. As we are just a content provider. As youngsters and adolescents, you're just a content provider. There's a very big politics going on. Even Facebook has a separate division called, global governance and politics. It's a very big team for them, global governance and politics. They have conducted an election in more than 60 countries. Facebook had conducted election. They used to approach the politicians and bet them that we have this much of users in this country and we can mesmerize them. We can manipulate their brain, and accordingly, if you pay us, they will vote for us. They do lobbying as well. They've done it in India as well since 2014. So we are just a product for them. Think about it. When you are getting something as free of cost, then you are the product. You are just a product for them. They're not here to serve you. They take all your personal information and they make business out of it. And a lot of people used to say that, like, especially youngsters used to say that, like, I used to get a lot of information in Facebook. That's the reason I use Facebook. It's not so. When you get some information in mainstream media, all these informations are verified, cross-verified, and then it has been telecasted or broadcasted in mainstream media. But the information posted in social media is nothing but, the expressions and feelings expressed by someone else, whether it's genuine or fake, irrespective of that. When they feel something, they express it as the form of news to get more shares, likes, and comments for their postings. That's it. And cyber clone. When you use your mobile phone, think about it. Your mobile phone is nothing but you. Your clone, of course. Even we discussed a couple of days back. Where we were been using a smartphone, we came across a case where a parent has approached us stating that I've received pictures of my daughter. It's something in nude pictures, and the person who had sent that as threatening us, stating that, like, he will post these pictures in social media and is demanding some ransom. Accordingly, we traced him, and accordingly we got the culprit, and he was placed behind the bars. But however, we want to analyze how this happened. So we have done some exercise on that. So what we have done is, like, we have given a mobile phone to one of our employee. It's a smartphone, and he's a male, and we have given to him and asked him to sell this mobile phone to get what will be the actual cost of this mobile phone if it's sold in the second-hand market. Like in Chennai, we have Burma Bazaar and Trichy Street are the areas where we can sell second-hand mobile phones. That's used mobile phones. So he went to each and every shop, and they offered about 300 rupees, 500 rupees, or 700. At the max, we got a 700 rupees quote for this used mobile phone. And subsequently, we have given this the identical cell phone to another girl, a good-looking girl, who she is working in our office. Accordingly, we have given that smartphone to her, and she went to the same shop. And these shopkeepers had said that we are going to offer about 2,000 rupees, 3,000. At max, we got an offer for 3,000 rupees for identical smartphone. We were, like, flabbergasted and dumbfounded. Like when a men approach a shop and hand over this smartphone for sale, they said about 300 or 400 rupees for that. But whereas a woman approached, that's a young girl approached, they offered about 3,000 rupees. It is not for the mobile phone. It's not for the mobile device. It's for the photograph stored inside your mobile phone. Digital footprint is permanent. You can never ever delete any photograph from your mobile phone. There are lots and lots of recovery softwares where they can recover these photographs at any point of time. So even if you reset your mobile phone, even if you flash your mobile phone, all your photographs and videos can be recovered. So my humble advice would be for adolescents, especially girls and women, never ever exchange your mobile phone while buying a new mobile phone. You may get about 1,000 rupees or 2,000 rupees, but you are submitting your life. Even as like very big showrooms who purchase these mobile phones for about 1,000 rupees or 1,500, they used to sell this mobile phone to the third-party guys, like such as guys working in Burma Bazaar and Trichy Street. But these guys will make use of these photographs because I know each and every girl take lots and lots of selfies, personal selfies, private selfies, and they will be thinking that no one knows about because we are deleting it instantly. It's not so. Once it has been captured, it is permanent. It will be permanently residing inside your mobile phone. That's the reason, like if you purchase a mobile phone and use it for about 2 years, even after uninstalling all the application, deleting all the photos and videos in it, it says memory full, memory full, memory full. because nothing goes out of your mobile phone. Everything resides within your mobile phone. That is the reason after usage of about 2 to 3 years, it says memory full, even if you do all the activities. Yes. So be cautious on that. And smartphone addiction has already been discussed earlier by the earlier speaker. So some of the major type of attacks against girl are nothing but cyber stalking. Cyber stalking is an offense under the Information Technology Act. Cyber stalking is nothing but when a person gives you a repeated missed calls or sending a repeated messages through WhatsApp or giving a repeated friend request using Facebook or any other social media. It's called cyber stalking. So if you feel that you have been stalked online, then you can immediately report to the nearby police station and you get a remedy out of it. And cyber smarting, as I said earlier, the cyberspace gives you a platform where you can express your ideas, views, thoughts, everything. But also you can satisfy your grudge. You can satisfy your ego. So once something happens between you and your close friend, then the first weapon your close friend will be using against you is nothing but your photograph, either to defame you or to tarnish your image. That's called revenge pornography. So that's called literally revenge pornography. It's nothing but like your own photographs will be used to tarnish your own image. We have seen a lot of cases. In Chennai itself, we have seen a case of, there was a complaint. A girl says a fake profile of her was opened, and all mocked photographs or obscene photographs has been posted in that particular page. And subsequently we contacted Facebook and we got the IP address, and through the IP address we got the postal address of the person who has uploaded the photographs, and we were surprised both the complainant's address and the accuser's address are the same. So we went to that particular place, and we came to know it's a company. And subsequently we entered into the company, and we tried to find out the MAC ID of the system from where the particular photograph has been uploaded. And we were surprised to know that the girl sitting next to the complainant's seat is the girl who had uploaded the marked photographs. And we captured that girl and we inquired why you have done so. We were surprised to see what was the motive behind that. There was a quarrel between this particular complainant and the accused earlier in the canteen for some reason. So in order to tarnish her image, she made use of her photograph and uploaded the photograph in a particular Facebook profile page. And accordingly, she had shared the link of that particular Facebook profile to all the employees, to all the workers, to all the family members, everywhere. And subsequently, we got hold of that girl, and we placed her behind the bars. So we have so for the past more than 12 years, we have been handling this kind of cybercrime cases. And the modus operandi, we are studying a lot of modus operandi of the criminals, and most of the criminals are nothing but first-time offenders. They are not habitual offenders; they are first-time offenders when it comes to social media. So they will be under the impression that no one knows about it because we are simply sitting inside our residence and we are posting this photographs, or we are uploading this mock photographs, so no one can identify us. Think about it. You are using an internet. Each and every internet connection has an IP address. Once it has an IP address, we can easily track back the criminals. And the punishment for this is up to 7 years. Posting or uploading a mock photograph of a girl, punishment is up to 7 years. So beware of that. So one of the root causes for these kind of crimes are nothing but the digital gadgets that we handle, but we don't know how to handle it in a safer way. So as rightly pointed out by the earlier speaker, that it's a double-edged weapon. We should know how to handle it, whether it in a productive way or in a destructive way. So it is not so that we should be get out of this mobile phone, or we should not use this digital gadgets. We are left with no other option other than to use internet and depend on these digital gadgets. But we should know how to handle it, because as we use LPG, the cooking gas cylinder in our residence. It's also one of the dangerous substances that we use, but we know how to handle it. That's why we are using it in a safe manner. Similar to that, when it comes to online, you should know how to handle this. So in order to safeguard you and your family members as well. So there are so many cybercrime is offered as a service by the criminals. You can buy a service, you can sell a service, and you can hire a criminal. Anything can be done. There are so many and numerous criminal organizations working on that. The internet that we use in today's world is only 3%. Just we are using 3% of the internet. 97% of the internet are called darknets. And a lot of illegal commodities are available in the darknets, like as we use Amazon and Flipkart for purchasing goods. It's called e-commerce sites. Similar to that, there are lots and lots of e-commerce sites available in the dark market. It's called criminal bazaars. Illegal substances such as like cocaine, heroin, these are all called banned substances. It is available in the dark market, in the criminal bazaars. And also, a photograph of a woman and girl is also available in dark market. An average looking girl's photographs will be auctioned in a dark market between the range of $2 to $7. And the company who purchased the photograph for $2 to $7 will morph the photographs and sell these photographs to pornographic sites for $40. So never post your photographs in any social media. Even I would recommend not to keep your personal photographs in WhatsApp DP as well, because a lot of people, we used to save all the contacts. We used to save Autowala's contact. We used to save some mechanic's contact number in our mobile phone. He also saves our mobile number. And if he started using mobile, WhatsApp, your good-looking picture is available to him as well. He can make use of the photographs. He can illegally use the photographs as well, stating that this is my girlfriend. Look at this photograph, because she had personally shared this photographs to me, and she can tarnish, and he or she can tarnish your image as well. So beware of that. Even we have been seeing a lot of schools and colleges. They used to have a WhatsApp group for each and every classroom, and they maintain a Facebook page for each and every schools and colleges. And we have seen a lot of cases where 8th class student posted a mock-up image of 21 years girl, and we have shared that videos as well. And we have seen a lot of cases where in kids has been sent to juvenile prisons because of their ignorance. They're not aware what they are doing it, and the schools and colleges also failing them, stating that you should be there in online 24/7. So it's a shared and it's a shared responsibility. Like not only the schools, colleges, parents, and each and every person of the society has to safeguard the next generation. Otherwise, the next generation will be completely governed by artificial intelligence. We are living in the world of machine learning, and we have been governed by artificial intelligence and robots. We call it as bots. And each and every computer and mobile phone has network of robots working against us. If you use a 40 applications are working against you, not in favor of you. So think about that. And every criminals are organized criminals. It's not like that, like as we see in the conventional crime, the criminals are not illiterate. All illiterates will be the criminals. But here, when it comes to cybercrime, it's a white collar crime where criminals are highly educated. So beware that, like they run a very good organization how to make a crime out of it. Availing your free data. Free data is nothing but your own personal information, including your date of birth is more than enough to kill you. Yeah, these are the organization structures, and we have a lot of provisions under the Indian Penal Code, and we have a special enactment called the Information Technology Act to govern this. All you need to do is, when you feel something, that when you feel insecure online, kindly report this to the nearby police station or approach your lawyer accordingly. There are provisions available under the Information Technology Act. Once a complaint has been filed against a criminal, and definitely it is for sure, because as I said, digital footprint is permanent. Even for criminals, digital footprint is permanent, so easily we can track back the criminals. So all you need to do is, please, don't ignore any kind of this kind of activities. Please report to the nearby station. So deficiency to be addressed in the digital era is nothing but lack of awareness, hesitation to report, ambiguity in the definition, jurisdiction issues, extraterritorial applications. Even we have done cases where the criminal has been sitting in Israel. We have taken action against the criminal who has been sitting in Israel, and we have taken action against the criminal who is sitting in Italy. And there is no jurisdiction issues. Don't worry about it. The criminal is sitting in some corner of the world, so we can't take any action against them. We have extraterritorial application as well. So there is a solution for each and every case, but the path or the modus operandi that we approach is very difficult. So prevention is one of the best way where we can safeguard ourselves. So thank you so much. Thank you.
Thank you, sir. Sir, it was really very scary to know all this. I think not only the adolescents, all of us were not aware of all what you have said, and it makes us get scared to even carry a cell phone. So, and as you said, it's our clone, and since the camera is on constantly, I think it's really very scary for us to have one smartphone with us. I think we can get away with just an ordinary cell phone, which is not smart. And being smart is that way. Thank you so much, sir. Is Deepa there?
Yeah. So as very nice talk. As Vidya said, we are scared to use everything now. Even we have been thinking mobile and WhatsApp, Facebook have been our identity. So that our identity itself is being questioned here. So thank you so much. Very, very informative talk, sir. I think we move on to the next most awaited session. We have a great celebrity here. Can you stop sharing the screen, sir? Karthikeyan,
Yes,
sir.
ma'am. Yes.
So yeah, we move on to the most awaited session. We have a great person logging in for us. She is none other than Miss India 2018. She has a very, very inspiring story to tell us. She's can we have a video about her? I have been like yeah, this beautiful video. This is what captured my heart.
Destiny is not a matter of chance, it is a matter of choice. It is not a thing to be waited for, it is a thing to be achieved, as rightly quoted by William Bryan. Vanakkam. My name is Anukriti Vas, and I come from a land that is the home to a great diversity of cultures, languages, religions, and beliefs, India. I was born and raised in a small and beautiful village called Trichy, located in the southern part of the country where we speak Tamil, one of the only surviving classical languages in the world. It is this balance between the nature and the sophisticated Tamil culture, filled with art and music, that shaped my upbringing. It was a wholesome childhood with a happy family until one day my father suddenly abandoned us. I was only 7 by then. My life, as I had known it until then, changed drastically. Having lost the spine of my family, I was left behind with a very sensitive mother and a younger brother. Our conservative village community blamed my mother for our fate. So I decided to take charge of my own life because I learned in a very harsh way that I could not count on others. I joined the National Cadet Corps and became more interested in male-dominated pursuits like athletics and motorbikes. Over time, I took over most of the responsibilities of my family and became the man of the house. Surely a woman could march ahead of her times. Challenging the norms of gender and acceptance made me more confident about myself. It is this confidence that took me to Chennai, the capital city of my state, Tamil Nadu, and one of India's largest educational hubs. Even though I didn't realize back then, it proved to be a life-changing decision as it led me down the path that saw me being crowned as Miss India 2018. It is these choices, each undoubtedly born of circumstances, has made me who I am today. A confident woman, unafraid to challenge dated perceptions of what a woman should be and can do. A woman who has spent most of her years working with the orphans and transgenders, and the Miss India who is determined to use her voice and influence to elevate their inclusion. I know what it is to be without a complete family, but I also know what a difference a single person can make. I am Anukriti Vas, Miss India World 2018. I'm truly honored to share my life story and represent my country in Miss World in Sanya.
So that's our guest for you all. So there she is. Welcome, Miss Anukriti. Lovely, lovely to have you with us today. It's a big honor. It feels like Trichy OG Society has got a crown for itself. The Foxy president was here. Your video is on, but your audio is not. Audio is muted.
Can you hear me now?
Yeah, right. Yeah. So great having you here. The reason why I chose Anukriti as our celebrity guest today is not just because she is Miss India. She has a very beautiful background. She has come up from a very, very humble place, upbringing. In fact, her mother was a teacher. Am I right, Anu? Her mother was just a teacher. And she has been deserted by her father at the age of 7. And she has become a woman of her own right, her own merit, without any financial support, without any bureaucratic support. And she has risen to the top, the pinnacle of success. I would say this, she has bagged the crown for India. And she has been one among the top 30 at the Miss World 2018 as well. So welcome. It's a great pleasure. Is everyone, again, your audio is not working, Miss Anu.
No, it is working actually. Just a
Yeah,
minute.
now it's working. Yeah. Sorry, our Foxy president is unable to be with us at this moment.
No problem, no problem. Now is it fine now?
Yeah, your camera is tilted. Your camera has to be rotated.
You want me to, I got a message saying put it on horizontal, so I just changed it.
This is fine. This is fine. This is fine. Absolutely. So she is someone who is an epitome of courage. I can say confidence. I can say somebody who has passion, the drive to go up the ladder, and she has proved it for all of us here. That's the reason why I invited you here, Anukriti, for all the viewers to be inspired, and even we can take lessons from you, I think. So very nice of you to log in. Can I just ask you a few questions? Like your audio is getting interrupted again and again.
Actually, it's
now you're fine. Now you're fine. So tell us about the challenges you have faced as a child of a single parent. How did it feel at the age of 7? You lost your father left you.
So honestly, I didn't really feel any different because my mom is one of the strongest women I've ever known, and she is a single parent, and she was working in an IT firm at that point. And then I have a younger brother as well, but then she always gave us the best, whatever we asked for, the best school, the best extracurricular activities. I was in athletics, I was in dance. I did everything that I wanted to. I didn't feel like there was somebody missing because I lived with my grandparents, and my grandfather was my absolute favorite. He filled the place of a father, I should say, because every time I asked for something, he was there for me. And honestly, sometimes it just strikes you, yeah, I do not have a father, but then there are other people who fill the place absolutely better than him. So I always didn't feel the need for a father because I had people who helped me become what I am today, and my mom just filled the shoes absolutely perfect. So I didn't really feel sad or bad about him leaving us or me being with a single parent because my mom never stopped me from doing anything. I was brought up in Trichy, and when I said modeling, she didn't say no. She said do whatever you want. So I don't think I missed my father. I think I had two fathers because of my mother.
That was great. I think you've taken your courage after your mother. So
yes, for sure.
That's a lesson. Yeah, how parents should be. Perhaps your father left you when you were too young to even realize.
Yeah.
And,
yes, exactly.
That's what. So very nice. I think. What is a message you would like to give to the youth of today?
So I just want to tell one thing. If you really, really want something, and if you have put all your heart in it, and if you're working really hard, you might not get success immediately, but one day you definitely will, because that's what happened with me. the journey is really hard, I know, and especially if you're coming from a very humble background or from a very from not a city, like not from Chennai, Mumbai. If you're coming from like Trichy or whatever, it's gonna be hard to achieve whatever you want to. But then there are a lot of examples right in front of us. So I just want to tell them all, please don't ever lose hope, because if not today, tomorrow will definitely be yours.
Absolutely, absolutely. And what is it you're looking for in the? You also working for transgender, right?
Yes,
Can you
yes.
share some experiences? What kind of work you do, and what kind of activities you do, and how you feel about them? Are you working with children or elderly people, or how is it like?
So I'm actually working with an orphanage called Child. It's in Chennai, and they are educating 200 girl children whose parents were affected by AIDS. So after I won Miss India, we could get help from a few associations, and they came forward to help them. So we were able to help those children. And about transgenders, I had a friend when I was in Trichy who was a transgender, and when the parents got to know about it, they just went missing. Like they just went missing. They are not to be found anywhere. I've never seen her after that. So that is what impacted me, and that is why I wanted to work for them. And luckily, I met this person called Namita Ammu. She is a transgender. She went for a Miss Transgender World. Like she represented India in a transgender pageant, and she's now doing movies in Tamil. So she has been really, really helpful in this. She has adopted 30 transgenders, and we've gotten them work. We are helping them study. We've given them a place to live. Basically, we're just being there for them when their parents aren't there for them. Just that.
So it's great work that you're doing, really appreciable, beautiful. You're both beauty in and out, absolutely. So,
Thank you so much.
Anything you would like to say? Like, what is your day-to-day activity, like your fitness, or anything you would like to say to the girls of today, physically being fit, or what keeps you going every day? What is a typical day in your life?
So honestly, when you're fit from inside, like when you're fit and when you're happy, that really shows. So that is what I believe. And yes, I do work out every day, and I do not keep a very strict diet. I can't. I'm South Indian and I have to eat rice every day, like every day. So I eat whatever I want, but then I do work out. I do cardio sometimes. I go for a run. I do yoga. Just these basic things that are like our parents always tell us, we always omitted and we didn't do it. That is all that's needed, because before I joined Miss India, I've never been to a gym. I always just ran. I was a long distance runner when I was in school, so that really helped. I just went for a run and I ate properly, like rice, but yeah, I don't really like pizza, burger, but yes, I do eat whatever I feel like. And but most importantly, it's really important to meditate once in a while and keep yourself calm and keep yourself connected to the nature, I think, because when you know yourself, when you know your positives, when you know your negatives, and when you are absolutely fine with yourself, it really shows, and that is what makes you confident. So I know we all have flaws. Even I do have flaws, obviously, but I've come to terms with it, and that is what helped me become Miss India. So I just want to tell you all, just be happy and do whatever you have to do, because my day is just like I get up, I work out, I come back home, I do auditions. I've now signed a movie, so I'm doing script reading for it, and that keeps happening. And then when I have free time, I go to YouTube, I watch videos on how to act, because I've never been to acting school, I've never been to a modeling agency, I've never joined any class for anything. I just learned it all by myself on from YouTube. So I just think you can do whatever you want if you really want to do it.
Absolutely, very well said. I think that's great advice to all the youngsters. Just be happy and be passionate. I remember you are a dancer too.
Yes.
I remember the day my son called and said, like,
Yeah.
my partner who's a dancer has been crowned Miss India. So
Yes.
you're a great dancer as well. So your passion takes you wherever you are, right?
Exactly.
And at any point your mother felt like, before you were crowned, at any point your mother was anxious, or like she said no to your
Oh, she really was, because I was a very, very naughty kid in school. Like, really naughty kid in school. I did everything except for studying, honestly. I was a good student. I don't fail, but I'm not a topper either. I really like doing extracurricular. I really like art and music. So in fourth grade, I first joined my dance class, and that's the first time I ever went on stage. I ever did anything. So I think my dance class was the first place that truly made me understand what I really want to be when I grow up. Because after joining dance class and after being on stage is when I realized I have to become an actor. And my mom really didn't have any idea about it, because she was born and brought up in Trichy and Kerala. So she has no idea about modeling or acting. And we don't have a male support in the family, as to say. And we do not have a very big background also. So of course she was scared, because she's a single parent, and I'm the eldest daughter, and I'm really naughty. So when she sent me to Chennai, she was a little skeptical about it. But when I started modeling, when I did it, she just told me, if this is what you really want, then go for it. Because I gave her the trust. That is what is more important. Because if you want to do something, and if you're actually trying hard to become that, your parents can see it. They will be skeptical, they will say no in the start, but when you are really trying hard, when you put in the effort, they can see it. They're parents for a fact. So
Wonderful, wonderful. I think this is a message we exactly wanted to give everyone. A very positive attitude to life. Talking about life skills, how you take up failures in your life, and how your passion has driven you to the top, and all that. I think, are there any questions to address Anukriti? Anybody else? I'm not sure. We have a big audience. Anyway, I think it's time to thank Anu. You're the pride of nation, the pride of our city, and the pride of youth for today. Thank you so much for logging in.
Thank you so much for having me.
Thank you so much. It's been pleasure having you with us today. Thank you.
Thank you.
Madam, we have our Vice President here, Dr. Ramani Devi. Would you like to say something, Madam?
It was nice to hear Dr. Kriti's advice to, or rather, I should not call it as an advice, her talk to the youngsters. And she is doing a wonderful work. And I wish her success in future.
Thank you so much.
Anu, I am also from Trichy, been born, brought up, and a senior consultant in Trichy. I've been growing up. Thank you. Congratulations.
Thank you so much.
Yeah.
More women making Trichy proud, I think. And we have Dr. Vidya Ravi, our society president. Vidya, would like to have a word with Anu?
Yeah, it was nice watching her video. It was like watching a movie. So I just went on to relax. So nice, Anukriti. I've been hearing lots about you through Deepa. And it's nice that you have the courage to face life on your own. So that's a very good message, positive message for the adolescents. I think all the youth must follow this, be more positive and take the positives within you. And like Anukriti was, you all will definitely shine one day or the other. Though, as she said, though not in the future, you will definitely go ahead one day or the other if you have the passion and hard working. Very good message, Anu. Thank you so much for being with us today. And
Thank you for having me.
Shine like a star.
Thank you so much.
We have just one question from Mrs. Maithili Ramanan in Trichy. What was the first thought that crossed your mind when you were crowned Miss India? What was the first thought that crossed your mind when you were crowned Miss India? Did you think of your mother? Did you think of what did you think?
The funny thing is, nobody from my house had come for the finale, because I never thought I would win, because I had no experience whatsoever. So I had given my passes to the other contestants. So when I won, the first thing I thought was my mother should be here, like should have been here, because I won, and there was absolutely nobody that I knew on this on the whole stadium. There were thousands of people, and I don't know anybody. So the first thing that came to my mind was my mom should have been here.
Very nice, very nice. I think we can call this a wonderful rendezvous with Miss India 2018. Best wishes for your future endeavors. Very soon we are going to see you on the big screen. Best wishes. I have watched some of your videos. You're very good at acting also, so multi-talented and beauty. So thank you so much for logging in. Thank you very much. Thank you. So we move on to our next short session. We can make it a little short. We have some panel discussion on some real life case scenarios. Do we have the faculty in here? Dr. Harish has excused himself because he has some other meeting. Madam Dr. Rosa Oliai, Dr. MC Patel.
Hello.
Sir, are you here, sir?
Yes, I am here.
Divya, we can't open our videos.
Yeah, they have muted our videos.
Oh, what happened? Yeah, okay. I thought you all. Is Gaurav there?
Yeah, now it's unmuted.
Should I just escape? Who are all there? Are all the panelists available here? Dr. Om Sai? Rosa Madam?
Yeah, I'm there.
Rosa Madam and Dr. MC Patel are there.
It's just I can't
Mr. Karthikeyan?
Yeah, we can just ask few questions, Deepa, to the...
Yeah, just 4 or 5 questions. Who else is there? Mr. Karthikeyan sir is here. I just need to know.
Yeah, he's there. He just now spoke. No?
Okay. So just quickly going through our first case. This is what we are talking about is all real life. Here is a 19-year-old obese 95-kilo girl coming with missed periods. Says she lives in a hostel away from home. She's studying elsewhere. She has a partner and she's anxious now because she has a missed period. Madam Rosa, Madam, can you take this question? How you would proceed and what you would on what lines?
Yeah, so here there is a 19-year-old, a teenager, 19, again, teen adolescent. She's going to finish her adolescence very soon. She's very obese. Her BMI is on the higher side. She's missed a period and she is at the same time in a relation. So here one would think about the first thing, if a girl who's in a relation has come to us, pregnancy. So I would definitely think in that direction, get a urine pregnancy test done. However, such an obese girl, 19 years, I don't know her background of her other history. She is under the problem of a polycystic ovarian syndrome. So we say because she's obese, she's got the problems of missing her periods. So I think this is, she has to really take this a little more seriously and she needs a lot of treatment. I would advise her a lot of diet treatment. Let's think about she's not pregnant. Let's assume she's not pregnant. So a lot of diet, a lot of lifestyle modification. Psychologically, she's going to be depressed because PCOS reads nowadays, the latest guidelines, H3 2018 talks about psychological factor, nutrition separately. And of course, there are very good medications now available, which you can take regularly. Like as I mentioned in my talk, oral contraceptive pills are there, where they could help her out to decrease the androgen level, which is more prominent in the PCOS patients. Coming across with her, if she's pregnant, now let's see that, assume that she's pregnant, depending on the weeks of her pregnancy, as I mentioned, if she goes as early as possible for an ultrasonography, we can get to know what is the weeks of her pregnancy. Now, if she is less than 9 weeks, as I said, medical termination of pregnancy pills are there where she can be taken. This needs to be counseled. I mean, you have to go to a doctor. This is not present over the counter. You cannot take it just like that. And it's got 90% of, getting rid of the pregnancy. So I would advise her to see a doctor, a health professional as soon as possible.
Thank you, ma'am. Dr. Patel, sir. Let's assuming that she is pregnant. What are the legalities involved? Can she undergo a termination on her own, or should she call her parents or her partner, or what is the legality here? The situation.
Before I answer that question, Roja, I would like to add her blood grouping testing also. Because if at all she is negative, then injection NTD should also be considered. Hello?
Yes, sir, you're audible. Please go on, sir.
Yes.
What about the consent and other legalities of the issue of pregnancy here?
So first you confirm her age, whether exactly she is 19. Many a times they give wrong history. She is 17 or so and she will tell she is 19. So first confirm her age by any valid document, say for example, a school leaving certificate, election card, Aadhaar card, any document. If she is 19, confirmed age, then she can very well give consent for termination of pregnancy and nobody else consent is required. She can very well give. If at all she is less than 18 and she has given wrong history, then it becomes a case of POXO and you have to inform police. If she is more than 18, 19, then not to need to be informed to police. But one word of caution, because many a time, of course, it is with her partner, but we should be careful at the time of counseling and taking consent. One, my age is 19. Second, this was result of consensual sex. Third, I have no complaint against anybody kind of rape on me. So if we have taken this type of consent, this is abundant caution, then there won't be any problem. Otherwise, what happens in this type of cases? The same partner, when refuses to go for marriage, then she may complain in police that the consent was taken for false promise of marriage. And if at all it is false promise, then it becomes a case of rape also under section 375 of Indian Penal Code. So we can very well terminate pregnancy, no problem. But to be on safer side, on part of treating doctor, we will have to take abundant caution at the time of taking consent. Yes, Deepa.
So very nice. We have to take her proof of age ID.
Yes.
And if she is less than 18, even if she is not pregnant, we got to inform the police, right? Even if it is consensual.
Yes.
Right, it can be still a case of rape, or so the message is loud and clear to the youngsters less than 18 years. Please refrain from having any sexual activity, because there is a law that is governing this, and we are even if we want to be empathetic, we can't escape this law of informing the police when we come to know of a situation like this. So very nicely said, Dr. Patel.
One more, Deepa.
Huh.
She is less than 18.
Huh.
In that situation also you can terminate pregnancy. But after informing police, you will have to inform police that on this particular day you are going to terminate her pregnancy. You will preserve product of conception in normal saline and not usually we preserve it in formalin. So it will be preserved in normal saline, and you will inform police that you please collect product of conception, sending your representative as a evidence of pregnancy. So this is also one more important thing when you terminate pregnancy less than 18 years of age.
So how long we have to keep the evidence with us?
Once you have informed police, then it's the responsibility of police. You can preserve for 24, 48 hours or so. If you preserve longer than this, it is in normal saline. So by that time it will perish. So you will have to inform police that you collect this product of conception same day. Otherwise, it is likely that it may get perished and then evidence may be not available to prove. So once you inform that it is ball is in court of police, when to collect. If at all they do not collect, then also you are not at fault because you have informed police. Your job is over.
So suppose a police, is this an FIR or we can just give a letter to the police? How is it?
Simple letter will do, but it should be with acknowledgement. So you have to mention in your original copy whom you have informed, that police station officer, his buckle number, date and time. If they do not want to give acknowledgement, so many times it happens, police do not give acknowledgement, then you can have a call on number 100 because it is recorded call. Either you can send it by mail, it is good proof. You can have a recorded call on your part also. So you should be in a position to prove that you had informed police. And if at all police do not cooperate, then you can complain to his higher officer also.
Okay, very nice. Very clearly explained. Thank you, sir. Madam, would you like to, suppose she is not pregnant, would you like to consider she has a partner with her, some kind of a contraceptive advice and
Yeah,
HPV
so
vaccine?
the weight that you described, 95 kgs, BMI is very high. So if I give her any hormonal contraceptive, we have to think about the deep vein thrombosis that will happen to her. So she has to be counseled properly. And well, she has to try to use barrier methods of contraception for some time. And she has to try to decrease her weight. Even 5% of decreasing weight in PCOS patients will make her regularly do menstruate. You know, it decreases the androgen hormone and she will be able to measure. But however, 95 kgs, I don't know how well she'll be able to decrease her weight. She may have to go for some kind of bariatric surgeries also if she's not able to. At this, I mean, this is quite a high BMI. Contraception, yes, the adolescent who was sexually active, leave aside her weight, but basically, if these girls come to us, we have to tell them to use dual contraception. So it cannot just be an oral contraceptive pill, it should be also a barrier pill, as I mentioned, because we are worried about sexually transmitted diseases and sexual partner to be just one, not to change your partner.
Absolutely, ma'am. Probably she needs a lot of motivation. She might have low self-esteem, which is why perhaps she has a boyfriend to reassure herself that that kind of a situation also may be possible. So thank you so much, Rosa ma'am and Dr. Patel. We go on to the next question. This is, my slides aren't moving. Okay. So this is again a 20-year-old college going son reports casually to the parent that he has an inclination towards same sex, and this is a burning issue now. The parent seems to be shocked. So how to approach this? Should the parent take him to a psychiatrist? Should the parent counsel this person, or what should be the, is there a science behind this, and you know, is there a legality behind this, and what kind of counseling this person requires? I think the question can be taken by Dr. Om Sai. He deals with these kind of real life situations very often. Dr. Om Sai, please, can you answer this?
Yeah, before I answer this question, I would like to request you, in case if any more questions are there from the audience, I think we should have some time for that in case. But anyway, we will answer this. Now, this is a very tricky situation, and parents did not realize for 20 years, and suddenly a boy comes to the parents and then tells, yeah, it is definitely a shocking news to the parents. Now, how to go about this? The best thing should be that, you know, the parents should play a friend's role. Actually, they should sit with him, try to understand, develop rapport, listen to him, allow him to speak. Why is he thinking that, you know, he has inclination? Is it just an inclination, or is he having clear orientation? And then suppose if they have understood it, it's okay. But otherwise, if they have not understood, they should definitely consult a counselor. They can consult psychologists, they can consult psychiatrists. Definitely, we do get such kind of cases in our clinics. What we do in our clinic? First of all, we give privacy to the individual. We make him separate. We make him sit separately. We listen to him, and we also talk to the parents separately. We try to understand what is their observation from the beginning of the life. From the childhood. No, suppose you have somebody who is having homosexual thought. It doesn't come overnight. It's a process. It takes place. And you can definitely identify his deviations in his behaviors, or atypical behaviors, which are not common with others from the beginning of the childhood itself. So when we sit with a child, in the individual, what we do is that we try to understand what exactly is he having. Is he simply having a sort of a inclination because of the peer pressure, or is he just getting influenced by certain people, or is he really having homosexual thoughts? Everything is accepted in a right sense. All things are possible. We need to explain him in advance that yes, somebody at your age can have some homosexual thoughts. Somebody at your age can have some heterosexual thoughts. Somebody can have preferences towards the opposite sex. Now we would like to listen to you. What kind of thoughts you do get? Is it that inclination means that you would like to get along with that particular same-sex person as a life partner, or is it that you want to have sexual relationship, or is it that you simply like you like somebody in a cinematic field? So we need to understand his mind, and then we need to help him to clearly understand that these are the possibilities. Suppose he choose, let's say, I would like to lead a life with this same sex person. No problem. We need to support them, and we need to politely tell them what are the available legal positions. Yes, it is acceptable to have same kind of same sex relationships, and we need to enumerate the precautions which they have to take in their lifetime, and how to deal with that in case if they encounter any situation. For example, mother may say that I don't want my son to be in such kind of same sex relationship. This can be a very, very, very common thing. Most of the times we do encounter in our clinical setup this kind of things only. So we'll have to educate them. We'll have to help them to understand. We'll have to help them to understand legality, because he's already 20 years and he's an adult person and he can have his own choice. It's just a choice. So we'll have to explain the parents also. And so this kind of things we do. And then probably intervention is it's a process. I mean to say that it doesn't end up in one session or two sessions. So we call them periodically, and we do talk. We do differentiate it from the gender identity problem, and we also have to discuss about other things in life. He cannot have only preoccupied with his you know uh, relationship alone. We have to talk about his career goals. Everything will be taken into consideration, because most of the times we do see that they may have some other emotional disturbances. We need to address that also.
Sure, sir. Is there really a science behind this? What I understand is the estrogen is responsible for, in girls, for attraction towards the opposite sex, and testosterone the reverse. So, how does this whole thing work scientifically? I'm not sure.
No, I would like to mention it here. The one thing is that, as we grow, most of us would have had certain instances where we might have had some homosexual feelings. It is not completely abnormal. But then what dominates when the person becomes adult, from adolescent, when puberty, and then those stages, the most of the people will be attracted towards the opposite sex. So there is no clear. I don't know. At least I may not be able to explain. I mean, other panel members can tell if they have any biological reasons for that. But then we can only understand that it is just a choice, and then we need to respect.
Any other panelist would like to comment, Rosa madam or Patel
I,
sir?
I think Dr. Saab, Professor Sai has already said, and I think we have to respect. We have to respect the feeling,
Exactly.
right? So I don't think there are there any kind of a, we cannot just be judgmental. We cannot be judgmental. We need to support them and respect their opinion and their feeling.
Thank you, madam. Thank you. Very nice. We move on to the next question. A 20-year-old college student who is unable to cope with the pressure of studies, and the parents probably push him into a course that he did not like. This is very common. Parents take the choices from the children. So now he has suicidal tendencies. Not very often we even from IITs every year some suicides are being reported. So what would you like to, how do we go about this? How to identify such a situation earlier? And I'd like to ask whom to contact. Is there a helpline? And what will be the course of action if we come to know about this? Dr. Omsai, you can take this question.
See, this is a very common phenomena which is encountered in our clinic these days. And being in a medical college, and we do have a lot of MBBS students coming to our clinic with this kind of complaints. So we have to take it seriously, and then we have to respect the individual thoughts. If he's getting suicidal thoughts, that means we need to take it seriously. And it could be cry for help sometimes. So therefore, we really have to help them. So how do we go? The best is that we, as I said earlier, that we will have individual sessions and we try to develop rapport. We try to listen to the entire, uh, uh, chronological order of events which have taken place, and we try to understand: is it impulsive type, or is it because of the underlying depression, or is it because of the underlying personality disorder? So this kind of differentiation needs to be made. And then the most important thing which we do at that stage would be risk assessment. For example, you have, let's say, severely depressed person and who is talking about suicidal thoughts, versus somebody who is having vested interest and trying to threaten the person by suicidal gestures. So this is two different conditions. So we'll have to assess the risk. So in that, we have two important things to assess. One is, what is the lethality with which the person might have tried, in case if he has tried, and what was the intent? Is he really want to do attempt and do complete the act, or is it less intent? This kind of assessment we do. And then we also have to take his permission and share all these things with the family members or any caretaker, or sometimes it could be a friend also. But before that, we need to take his consent. Like, now I'm going to talk to your father. I'm going to discuss. I'm going to listen to his concern. And I may even tell him that what you are feeling. Is that okay to you? This kind of questioning needs to be done before we go ahead and, help the family. And then family needs to be told about certain important things when we discuss with them. They'll have to take these things into serious consideration, and it could be part of your depression, or it could be just a cry for help. And if it is so, what is the situation which he or she is facing at present, and therefore they'll have to go into the details. And they also have to be watchful. Suppose if you compare with that person who has expressed suicidal thoughts or suicidal ideations versus who has not expressed any time in lifetime. So naturally, the risk is more with that person. So therefore, once expressed, once attempted, the risk goes on. So therefore, we'll have to be more careful. We'll have to be watchful. Keep the sharp objects away from them, and don't give the medications. Access to the medications to them. You have to supervise, and somebody has to be along with that person all the time. And these kind of cautions we explain to the family members. And I always feel that most of the physicians, clinicians, including some psychiatrists, will have some reservations and difficulty periods to elicit this kind of history. But I strongly believe that you should ask a straightforward question to the adolescent about suicidal thoughts. If you have any doubt, you just make him sit alone and ask straightforward question. Do you have suicidal thoughts? Many clinicians will hesitate to ask like this, but I am of the strong opinion that you should, because the one question of such kind will give you a lot of information. The adolescent will give you a lot of inputs, and then probably we can help them.
So thank you so much. Very nice explanation. The whole country is mourning the celebrity Sushant Singh's death. We are all introspecting what could have gone wrong. So it's always good to be aware of things like this in our children and our youngsters. And maybe prevention and treatment at some stage might have been very useful. Thank you so much, sir. Before we take the next question, we have some questions from the audience. Ms. Cassandra has messaged, how can we stabilize our mental health as normal always? It's a blanket question.
No, it's a very good question. If you think in another way, it is a very good question. Like it, I can answer like this. See, everybody would be thinking about their physical health. Correct. And everybody wants to maintain good health. They mean that physical health. They don't want fever. They don't want pain. They don't want suffering. All those things everybody knows. And then if they have weakness, then everybody would know that they'll have to eat well. They'll have to exercise well. So these are the techniques or the strategies with which we maintain the physical health. Likewise, there are certain strategies with which you can maintain your psychological health, which means probably like we have exercise for the body, you do have certain things for the mind. Probably you try to relax more, you try to, you should know how much stress you should take at a time, and you should practice certain things like yoga and meditation periodically, and you should know your own capacity. Accordingly, you should be realistic about your own capacity, and then deal with the situations in life meaningfully and appropriately. And then probably as somebody said in earlier, if you maintain good health, invariably you can even try to maintain good psychological health, and vice versa is also true. So therefore, you do good practice for physical health. Likewise, you should do good practice for your psychological health also. Maybe you should
health exercises are available, sir.
Yes. And like in the sense, like, don't get into rage, don't get into unnecessary arguments, don't get into too much of stressful situations, and try to minimize your appetite for the success. All these things will help you maintain your psychological health.
Thank you, sir. Thank you, sir. Next question we have from the audience for Rosa ma'am. What age should the adolescents be made aware of contraceptives when there is so much lack of knowledge regarding menstruation itself? So this is a difficult thing. Maybe both together, or what do you say?
I think what I would say as gynecologists, as I mentioned earlier, girls usually come to us at the age of 10 to 11 years. Most often when their first menses begin. So as a professional, when I have a girl who comes to me first time, the mother is so worried, ma'am, she started menstruating. So that's the first time I come across the patient. So it is at that moment that I try to counsel the patient. I try to talk to her in a very friendly way. And I'll first make sure that the mother is quiet, because often it is the mother who's very anxious and tries to make the little girl, 11-year-old girl, nervous. So often we see now the age of menarche has become between 10 to 11. So what I would do to this girl would be, I would first advise the mothers who are listening to us, if they're still there, it's 9 at night now, to take their girls to the gynecologist, because they cannot counsel the girl. So when they come to us, we talk to the girl. We would make her feel very quiet. We will tell her that is something very normal, nothing abnormal about it. Now you've become a lady. So you will have to take care of the way you wear your clothes, the way you sit. We would counsel her about using her pads properly, disposal. We would also tell her the first year of her menses would be irregular because the hypothalamo pituitary ovarian axis, in layman's terminology, the hormonal thing which starts from the brain during the menarche first 2 years is very immature. So the girl will have sometimes menses, sometimes will not have menses. So there's nothing to panic. However, the mother should be, the girl also should be very careful. During this age, during this period, she may get pregnant if she is sexually abused. Well, the health education, as I mentioned during my talk, Foxy, we've been working towards it. We try to inculcate this in the education, in the schools. And now your second part of your question, which talks about when do we talk about contraception?
Correct.
So there are certain category of girls who come to us. Now things are so open. They Google, they come directly. I've got a lot of girls who come to me, not teenagers, but cross teenage. They directly ask questions. Well, that's easy. But those whose parents don't know anything, those girls who feel shy to come to us, I think the time to counsel these girls, you cannot catch them. You cannot just catch anybody, come, I'll tell you about contraception.
Correct.
We should advertise places where it is available. And we must make it, maybe the policies, the media, everything is together. We must make sure that these are safe and where they are available, where they are accessible. This is what I mentioned during my talk. So you cannot say at what age they should be exposed. However, when these girls come to us, to the gynecologist, when they are a little more mature, past 1 or 2 years of menarche, I think that's not a bad time to talk about how pregnancy happens and how there are certain things to take care of. So the education as a gynecologist, where I would give to my girls would be when they come to me first time. Maybe a pediatrician would face these girls a little earlier, but then they are not under the position of giving contraception counseling to them. That comes to our domain. So I think that is a right age where I would be talking to these girls and telling them prevention is better than cure and would talk about this to them. So I think this should also be inculcated as health curriculum, not that directly because sometimes it's taken in a different way that you're trying to expose them to things which they are not supposed to, sexual contacts and all that. This is a tricky question. This is definitely a tricky question. I would say that those mothers who are really concerned, you cannot do the counseling. Go to your gynecologist.
As Dr. Harish mentioned, whenever the child is curious, I think about sex, I think contraception also, you probably, if they have enough knowledge about this, probably you can start advising them.
Yes,
in my practice, madam, the youngest girl I have seen with the pregnancy is, I think, 12 or 13 years. Just 1 year after menarche, she came with a 2 months pregnancy and the whole life changed.
So one thing I want to say about bad touch, good touch. This is when we inculcate when
actually,
the girl.
There is another question, madam. There is a question from the audience regarding 1 second. Sorry, sir. How do we counsel? How to educate children regarding sex abuse?
Yeah.
This Rotarian has asked this question.
Yeah. So again, as a gynecologist, I face girls who come to me around 10 to 11. So once they start the menarche, once they start menstruating, during my counseling, the gynecologist should tell to this girl that there are certain areas that should not be touched by a person, and that touch should not make you feel uncomfortable. So the touch which makes you uncomfortable is bad touch. So good touch, bad touch. And usually like we try to make a diagram of a swimming costume. The areas like, when you wear a swimming costume, the areas which are covered are areas which should really not be touched. However, she should be careful that nobody should try to make her feel uncomfortable. So the best way for the parents to teach the children is that anyone who comes to you, uncle, aunties, anybody, and hugs you or does near comes to you, which makes you feel uncomfortable, try to be away. And at the same time, she should be counseled, speak it out, inform mommy and daddy, the closest person you are, and that she should not keep that to herself. So we have to be very important in teaching her at that stage of time and also telling her to inform, not to keep that to herself alone and, gets bullied away as the talk was This is according what I feel, and I think Dr. Omsad or KMC Patel wants to add anything on that legal point of view. I think this is the crux of the whole thing, which all of us would do. So yes, as a gynecologist, 10 to 11 years again.
Actually, madam, I would like to say maybe we should go a little earlier. I don't know, because we are reading so many reports saying even 7-year-olds and 8-year-olds are getting abused. So it's really a matter of importance, I think. I came across a patient who left her husband, recently married, but left her husband for 1 year. When I asked her why did, she was very young. So when I asked her why she left her husband, she said she saw her husband meddling with the next neighbor's child. She was 7 years old. So immediately I asked whether she reported this to the child's mother. She said, no, the societal compulsions are there. I don't want to expose my husband. And she has left her husband. But then, the child is, what the child is going through, we are still not sure. She did a mistake. So the first thing I said was, it is important to go talk to the mother of the child. So we do see such instances. So maybe good touch, bad touch has to come in little earlier in schools.
In schools, yeah, absolutely. The school curriculum, absolutely. Absolutely, you're right, absolutely.
Dr. Sai, anything else to add?
Well, I think it is covered completely. I think I agree with you.
Sure. So we just go on to our. Can we take one or two more questions?
No, you just see when it's already 9 to 9:15, madam. When participants are still hanging around, or
yeah, I think Gaurav should tell us. Participants are still there. Is Gaurav there?
Because I think it was not intended to extend up to this hours.
Extend up to this time, yes. I think there are too many. There is a Facebook Live going on. There are some people logged in.
Maybe we can restrict these kind of questions. Maybe in case if any questions are there from the audience, we can answer.
From the audience, that's also not much. There's one question for Mr. Karthikeyan. Is he here with us, Mr. Karthikeyan? Karthikeyan sir is here with us.
I think he has left, Deepan. He has left.
Yeah. So I think this can be the last one to be taken. I think.
Okay.
19-year-old hostelite has come for vacation, found to be smelling of tobacco now, and then parents are suspicious, but the youngster denies. So this is a fairly common situation. Like, what do we do?
It is common in even adolescents as well as even adults also. But they don't accept, they don't come forward to take support from the medical people or family members. But then whatever the things which we can do as an individual, like, family as well as therapist, I think we should continue offering services. And we all know that, adolescents are, they try to find out the pleasure in everything, and they take the risk-taking behavior is very common amongst them. So they'll end up in using all these kind of things, substances. And the very important reason why these things are increasing nowadays is again accessibility. Earlier it was not so easily accessible, but now everybody, everywhere, everything is available. So therefore it is more often found. And one important reason what we found in our clinical setup is that the peer pressure. हमारा साथ में जो खेलता है वो तो पीते रहते हैं, तो इसलिए मेरे को भी पीना पड़ा. This kind of statements we do come across very often. They get influenced by the peer very, very easily. And of course, the second thing is the media. Both, you can call it as television or cinema or social media. These are the things why it is increasing. Now, when you find somebody who is not accepting, there is no other go other than waiting and persuading. And persuasion has to take place long time. And you have to try and reach him through parents or directly also, and explain him the consequences and difficulties which he may face if he continues, and explain him what are the stages of dependency which you may come across. Like initially you can still be called as abuse, and then misuse, and then you can have what you call dependence, and then you need to tell him the signs and symptoms of dependence. And you need not uh, fooling around with such kind of adolescents because they know most of the things. So you can't simply threaten them by telling something wrong things. So you have to be genuine. You have to explain them very clearly, and they will ask you so many questions like, how do you know what is the the dependent, what is the kind of dependency I have in right now. Can you check my blood and tell me how much I have taken today? These kind of challenging questions are nowadays very many. So we'll have to be very realistic, and then we have to deal with them. Again, as I said earlier, it is a process. We sit with them in sessions, at least in once in a week. Like that, I generally plan for at least 6 to 8 weeks, and then slowly I will be gaining his confidence, and then I'll be guiding him to certain levels. And meanwhile, without his knowledge, I keep talking about his goals in life, and his strengths will be discussed. And instead of talking about only the limitations or weaknesses, I talk about strengths, and I highlight it so that there would be some reinforcement, so that he would come and talk to me. I give my phone number sometimes. I make him talk first, and then I talk to the family members, and communicate to him that he is important to me rather than the family. And mother tries to tell him that as soon as mother comes in, ये लड़का तो बहुत पीता है बोल के, they just start. But then I don't allow. I tell them, no, don't speak now. You just wait outside. I'm going to listen to him first. Then I'll call. I will tell very with a very assertive way, and then make the mother sit outside. This itself will help me to gain the adolescent's confidence on me. And then maybe he may share. Maybe he say that I do want to quit, but I don't know how to. Then you help me. Then I can take him further. I can tell him the various options available in the form of medication or in the form of chewing gums, all sorts of things.
So, are we good to take just one or two questions more, madam? This one is for you on premarital counseling. A 22-year-old engaged already to be married in about 6 months wants to know if she needs to see a doctor for any reason before marriage. So, and if so, one partner or both partners, what would you advise, madam?
Yeah, so premarital counseling is really very important, and it's very good that people are getting more aware of it. Both the couples, in short, should visit the doctor before marriage. It is happening in our big cities, big metros, smaller towns to a lesser extent. So during this, it is, a question, a history of the girl's history is taken, the history of a boy is taken, any diabetes, any kind of thalassemia, that means any blood disorders in them, and also a good history of their family. Anybody's diabetes in the family, the girl has got PCOS or not, the boy's family, anybody's diabetic or not, more so of the girl, of course. And importantly, a little history about the vaccination status of the girl, because there are two vaccines which I mentioned during my talk. I didn't mention about the rubella, but rubella and HPV vaccines are very important. Has she been vaccinated before marriage? Rubella takes about 3 months. So if you get vaccinated, you have about 3 months to become pregnant. So you have 6 months, she says here, so that's a good time. I would advise her to do that. There are, yes, certain blood tests which would help her. For example, a normal count, knowing her blood group and RH, knowing her thyroid status, simple test, sugar, just to rule out any, diseases, any chronic problems that she has, which could be taken care of. And of course, the thalassemia status of both the boy and girl is very important. I would say that should also be there in the armamentarium of the workout that we do. And of course, contraception. This is a good time that we can, talk to them about how to space the pregnancies after marriage. It's a very good period of time to expose them and counsel them. I think that also should be added in this premarital counseling.
Dr. Patel, can you just enlighten us about the legal age of marriage? And we still see many in our clinical practice. We still see many people who are married below the age of 18 or in their teens, below the age of 20. It's very common, especially in the some communities like Muslims, where they come with pregnancies second and third before the age of 20. So, would you like to add something on the legal age of marriage, Patel sir?
Before that, I would like to ask Roja, would you like to advise for thalassemia testing, HIV testing?
Uh, Thalassemia investigation, yes, I mentioned that.
Because sometimes it happens, both may be thalassemia minor.
So if they are both minor, then I don't know how the calculation would be. So if both are minor, then there are maybe the child will be minor as well. What do you say, Dr. MC?
Yes, and for HIV also.
HIV, yes.
Yes.
Actually, we had a patient we had a couple. They were just married for 6 months, and the girl came for a checkup, and we found that she was positive, HIV positive. And then we traced it to her husband. He was positive even before marriage, but he didn't reveal that to her. And she was a BA graduate. Unfortunately, he hid the fact from her, and then he got married. So, like, it's a difficult situation. Maybe I'm not sure. You can offer it to them if they are willing to take it.
Well, I think
Otherwise,
it's
without
important.
consent,
Yeah.
you still can't take a HIV test. Is that right, sir?
As such, it is not mandatory, but according to guideline of WHO and NACO, we should take consent before advising HIV testing. Because why I put this, just 3 years back, where one patient came to me in late pregnancy, she was HIV positive, and some doctor whom she was consulting regularly refused to give further treatment as far as delivery part is concerned. So at the time of history, actually when she was HIV positive, I advised testing of her husband also, and he was also positive. And then that lady told me that before my marriage, he was positive, and this fact was hidden. They didn't disclose this that he is HIV positive, and it was transmitted to me. So in this type of situation, and in one of the cases, in a court of law, it appeared like this. Uh, just like this, we are discussing for premarital counseling. Uh, Boy and girl had been to one doctor. He advised HIV testing, and boy was HIV positive. And doctor declared that to girl that your fiance is HIV positive, and that relation were broken, and marriage couldn't be possible. Then that boy filed a case against doctor as a breach of confidentiality. Why you gave this information to my fiance due to that my relation, and now there is no possibility of marriage with her. But in court of law, judgment was given in favor of doctor, because when it is in a public interest, then you can disclose this type of news to the other partner, because you cannot hide the necessary thing in the name of confidentiality. That is why I put. Yes, as far as age of marriage is concerned, naturally, as on today, 18 years for girl and 21 years for boys there, and government is seriously thinking to increase age of girl up to 21, considering malnourishment and anemia prevalence during antenatal period in this age group. But this is also uh, a vulnerable thing. In what sense? It may end into unwanted pregnancy after 18 and before 21 if age is increased up to 21 for female. And one more thing, POXO Act has limit up to 18 years. After 18 years, there is no use of any law if it is with consent. So there are so many questions whether this age is to be increased up to 21 also. And as on today it is 18, and rightly said, so many areas in our country, in so many states, where early marriage are very common, even at the age of 15, age of 16. And if I quote area of Maharashtra in the district of Pandharpur, so many of our gynecologists faces this type of cases when patient is brought in late pregnancy when she is just 16. So that means people she is married. But even if she is married before 18, doctor are in tricky situation. They will conduct delivery, they will go for cesarean section if it is indicated. But question was that should they inform police? Legally, yes. But then for how many cases? There are so many cases coming to our gynecologist friend in this type of area where early marriage is very common. So this is, I think, little customary tradition in some society. So that can only be dealt with proper education, proper awareness on part of public, on part of government, social organization, on part of our medical fraternity organization. Then only this problem gets minimized. But it will take very long period to go because it cannot be solved in a very small period. Anything add to Dr. Om Sai?
Yes, sir. You have covered it completely, I suppose. Thank you, sir.
I think with this we are good to go. Just what Mr. Karthikeyan had already mentioned in his talks, I just made some slides. I think I was also asking him about these hidden cameras. I think there are some bug detectors available. We are all worried about when we are traveling, our children are traveling alone. So there are some hidden cameras everywhere. That's one information that he gave me, and the rest he has explained in his talk, I think. And even smart TVs come with cameras, he was saying, which is not to be purchased. They've recommended that these be banned. So with this, I think we can call it a day. It's been a long day. Sorry, I think a lot of because the topics were all very interesting and absolutely national and international faculty. So they were all excellent. Thank you so much. Thank you to all the faculty. I think Dr. Harish and Mr. Karthikeyan has already left. So I wish to thank everybody for making this a big success. Thank you so much, Rosa Madam. First of all, I think I should thank Dr. Noza Sharir first. I already thanked him for linking me to Rosa Madam, and Dr. MC Patel is now a father figure to our society. I must thank our own senior member, Dr. Jayam Kannan, who introduced me to him first, and then he is with us every now and then. And now I think Dr. Om Sai and Dr. Harish have joined our family of Trichy Society, I think. So maybe we should do more. I actually planned this on a Saturday, but just that the dates were not convenient for everybody. So thank you so much for being with us. It's been great pleasure and honor. And a big thank you to Lupin, because Lupin has given a great support in terms of, it was absolutely smooth, the entire the video presentation, the presentations and everything. So Lupin has become a family to Trichy OG Society. Thank you so much. And not to mention the least, the viewers. I think there were so many portals, 2 Facebook portals, and then there was this doctor's link and there was this public link. So we are yet to know exactly how many people have logged in. A good number has logged in. That's what I heard. So thank you to all the viewers. Let's see, get the feedback and then I'll post it to you all.